Okay, good evening, everyone. I'd like to welcome you to the Tuesday, September 22nd, 2020 Radnor Township School District virtual special board meeting to discuss reopening plans. And we will begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic on which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to report that the board met in executive session on September 15th to discuss negotiations. And with that, we will get right underway with public comment. Mr. Petiti, could you read our public comment, please? I'd like to remind the public that at this time, public comment is submitted via email. You may submit your comments to boardcomments@rtsd.org. Please limit your comments to not more than 4 minutes as you read it. And you must give your name and address. And if you are unable to submit via email, you may send your comments in writing to Mr. Michael Petiti, Radnor Township School District, 135 South Wayne Avenue, Wayne, Pennsylvania, 19087. Mr. Petiti?
Okay, we'll start with Noel Palma, a senior. Hello, my name is Noel Palma, and I'm a senior at Radnor High School. I sent in a letter before explaining my situation and how sports affected my life. It's August 31st, sports are canceled and school is virtual. In my humble opinion, these decisions will only hurt the mental state of many students, including myself. My mom has returned from Honduras and is currently unemployed due to the pandemic. She has been told that she needs to stay at home. I don't believe that this is a solution, but instead a surrender to the virus. I currently have a 2.7 GPA because of my lack of commitment as a freshman. My junior year went pretty well, and I would like to continue to build on that success. Yet I am unable to, since I am a hands-on learner and struggle to learn via Zoom. I learn at a different pace than other students, so having the math center was such a useful tool. I'm doubling up on math this year, which puts a lot of stress on me since my mother doesn't know how to help me with Algebra 2 or geometry. I signed up for these courses under the assumption that I would have access to the math center. Now school is virtual and I'm stuck at home taking 2 math classes with virtually no support. Your hearts are in the right place. I know you're trying to help me, help us all. But after hearing my story, I hope you realize that your decisions hurt me much more than any of you could have imagined. You say that you're protecting my future, but if Radnor has taught me one thing, it's that my education is my future. Bring school back. Staying home only subdues my excellence and hinders my future. From Dr. Allison Leff, 432 Holly Bush Road in Bryn Mawr. Thank you for taking the time to read the attached letter at the September 22nd board meeting signed by almost 40 medical professionals who reside in Radnor Township and care for patients here. We appreciate the decisions you are weighing. Please let me know if you have any questions or difficulties in opening the attachment. We, the undersigned physicians and nurses, have reviewed data within the context of recommendations to move between phases in reopening the schools provided by both the Pennsylvania Department of Health and Chester County Department of Health. Radnor was below thresholds suggested by PDE and CCHD for offering the hybrid and virtual options on the first day of school. RTSD, however, voted to keep the schools virtual until October 9th, based on the contradicting guidance received by CCHD at the end of August. CCHD expressed concern for spiking cases after Labor Day, projected from patterns that were observed following the July 4th holiday. Now reminded, focus on COVID incidence rates ignores harms from keeping schools closed. As physicians, we are trained to look at risks versus benefits of each treatment and medicine we administer. For the treatment of school closure, we must look at the risks to students of increased rates of mental illness, obesity, and long-term loss of learning. According to the American Academy of Pediatrics, quote, lengthy time away from school and associated interruption of supportive services often results in social isolation, making it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical or sexual abuse, substance use, depression, and suicidal ideation, unquote. Data from the National Institute of Mental Health shows that in 2017, rates of depression among adolescents increased with age, and 18.5% of 17-year-olds had depression. Studies after the start of the pandemic show that overall rates of mental health illness have increased for the population between 20 and 50%. This increase implies that at least 1/4 of our senior class is struggling with anxiety and/or depression. Mass General Hospital summarizes many of the studies to date, which show the impact that schools closing is having not only on students' mental health, but their physical health as well. One such study, published in July in the Journal of Sport and Health Science, projected childhood obesity prevalence under COVID-19 to rise, and the magnitude of the increase was proportional to the length of time the schools are closed. Studies are beginning to measure the amount of learning loss that has occurred during pandemic school virtualization. According to a recent study at Brown, in addition to the expected learning loss that occurs when students leave for the summer, there's evidence suggesting further decline in math scores as measured by MAPS for grades 3 through 8. Almost a year's worth of learning is expected in the younger grades. Radnor missed an opportunity to provide in-person instruction on the first day of school when the numbers recommended by the Pennsylvania Department of Education and Chester County Health Department were well within the framework to offer hybrid education. Unlike the closing of schools last year, after months of in-person teaching that allowed for development of relationships with teachers and fellow students, Radnor students are starting off this school year without that support network. Teachers have minimal chance to know their students and identify those who may be struggling. Students have minimal chance to know their teachers and foster supportive relationships with them. Statements from Dr. Fauci, director of the National Institute of Allergy and Infectious Diseases, to our local pediatricians have acknowledged that we cannot drive the risk of getting coronavirus in the schools down to zero. The safety mechanisms that have been put in place in Radnor in anticipation of opening, i.e. face masks and barriers, are in line with the recommendations from the CDC, Pennsylvania Department of Education, American Academy of Pediatrics, Mass General Hospital, and Chester County Health Department. We urge the Radnor Township School Board to more fairly weigh the costs of additional COVID cases in Radnor versus the long-term harms of children's lost learning opportunities, worsening mental health, and lack of community support networks. On September 22nd, we are asking for a vote to support the choice of both virtual and in-person teaching for all of our Radnor students. Allie King, 32322 Bailey Road. I'm the mother of a first, second, and third grader at RES, and this is also my second year as RES PTO president. I want to thank the school board and administration for their conscientious efforts to get our children back into school safely. I would like to specifically thank Sean Dukevich, Director of Elementary Teaching and Learning, for the exceptional work in converting in-person curriculum into online learning. Radnor teachers have certainly stepped up during this time, coming into the schools to teach our children virtually, finding childcare like other essential workers must do, and pivoting when technology malfunctions. As great as virtual learning has progressed this year from last spring, there is something that remains clear. Our children learn best in person. I know we are all doing our best, and I know we are in a pandemic. I am hopeful that in-person learning is in our very near future. Metrics in our area are positive, and thankfully, because of our RT administration, we have an exceptional safety plan in place. Again, thank you, RT School Board, administration, and teachers for your time and careful efforts. Excuse my neighbor's dog if you can hear that barking in the background.
Michael, how many comments do we have tonight?
We're at 4. We have 13.
Okay, thank you.
Heather Gill, 431 Ivan Avenue, St. David's. Dear school board members and staff, thank you for taking the time to read my comments. The term health, as defined by the World Health Organization, is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I understand the importance of implementing school programs that safeguard our children, teachers, staff, and community from COVID, but this only addresses one of the 3 states of health defined above. I've watched the school board meetings over the last several months. I've listened to CHOP Policy Lab recommendations in the Chester County Health Department and seen the impact it has had on the board's decision whether or how to implement hybrid school options. I've begun to review data online from several reputable public health organizations regarding the significant rise in depression, anxiety, and suicide among children and adults. To date, CHOP CCHD has not reported data as it relates to depression, anxiety, and suicide. How can 2 of the 3 states of health be left unchecked by CHOP CCHD? The board needs to discuss both the risk and the benefit to the children returning to the classroom and give parents the opportunity to be involved in this process by giving them a choice to make informed decisions about what is best for their child's health. I kindly ask that the board look not only to the opinions of CHOP, but engage healthcare workers that can provide recommendations and data on depression, anxiety, and suicide. There are a significant number of healthcare professionals in our Radnor community that have analyzed the risk versus benefit and determined that it is safe for children to return to school. I hope that the board will vote to provide parents a choice at the September 22nd, 2020 meeting and allow all students to return to school immediately. I understand the staggered return to school is proposed. Each school is on a different campus and is already staggered by returning to school in an AM/PM schedule elementary or 2-day at school, 3-day virtual middle and high school schedule. Every age faces different academic and emotional issues. How can one propose that the health of one grade is more significant than other grades? The board previously voted on a hybrid safe at school model that did not include a staggered approach. Why stagger their return now? Providing parents with a choice of a hybrid model with an immediate return to school will have a significant positive impact on the lives of students and their families. Parents are quitting their jobs or taking a pay cut to stay at home with their children. Families have left our wonderful Radnor school system because they understand the benefits of a school environment for their children, of an at-school environment for their children. I hope that the school board makes the decision to be a leader again and provide parents with a choice to bring all grade levels back to the classroom immediately. Kimberly Kent, 712 Cornerstone Lane, Bryn Mawr. Please read the following before reading the letter. Reopen Radnor Safely Now is in full support of having the hybrid plan implemented immediately. Our letter was signed by hundreds of parents and includes individual comments. Members of the board, we, the undersigned district parents and caregivers, wish to advocate for the return of the hybrid option on September 28th, 2020, if transmission numbers continue within the PA state guidelines for hybrid learning. We are concerned that considerations by the school district for the social, emotional, behavioral, and economic health, as well as equitable access to education, took a back seat to COVID-19 with a decision to delay the opening of the school buildings for face-to-face instruction. The decision has amounted to a greater than 30-day delay to in-person education opportunities to the families who elected this option. 30 days can have a significant impact on families. 30 days is enough time to complicate or hinder access to behavioral health and supportive services, miss a rent or mortgage payment, lose a job because of the need to prioritize childcare over work, exacerbate depression and anxiety in at-risk youth, and cause a myriad of other negative impacts to the life of a child and the holistic health of a family unit. While it is understood that safety is of the utmost importance, the full consideration of the word has not been considered in a holistic manner. In addition to the risks associated with the novel coronavirus, which are contested by no member here, emotional safety considerations such as the increased risk for anxiety, depression, suicidal ideations, feelings of isolation, and regression of social skills have been lacking. Additionally, safety considerations such as the increased risk that child physical, emotional, and sexual abuse cases can go undetected and therefore unreported and unaddressed have seemingly not been considered. When included with the health risks posed by food insecurity caused by limited access to this life-sustaining service, the financial implications of childcare, and the potential of safety hazards related to young children being left unsupervised by families with limited childcare access, we have very real reasons for concern. While in school, students have access to supportive services and interact daily with adults trained in identifying signs of depression and abuse, all of whom are mandatory reporters. An adolescent peer is also more likely to be taken into confidence by a youth who is suffering from suicidal ideations. Guidance counselors and trusted teachers have often filled this role. While such services are still available via online communication, a major opportunity to identify cases is being missed. The financial implications to district families of a 30-day or longer delay in providing in-person education opportunities are staggering. While some private schools have opened their doors to district families, the costs make this an expensive option. The many learning pods that have formed between families are not widely available and are too often closed to children whose parents are considered to work at high-risk jobs. These unplanned financial costs are astronomical in nature, and the human cost of leaving young children home without adequate supervision is incalculable. Lack of adult supervision also comes with an increased risk to children's safety. This can be via lack of in-person supervision for younger children by overextended working parents or by households who cannot afford care. Some examples of these risks include household accidents, children leaving the home unaccompanied and placing themselves in unsafe circumstances while attempting to entertain themselves during their recess period. This increased risk to safety also applies to virtual safety. With the increase in virtual interaction, adolescents are also becoming much more comfortable with building so-called meaningful relationships via virtual platforms. This can, in fact, groom them to become a victim of an online child predator. The risks of COVID-19 must be weighed against the risks of the critical health concerns mentioned above. We strongly urge the Radnor Township School Board to consider reopening schools to all students who chose the hybrid option starting on September 28th. Dr. Pamela Bomio, 211 Hermitage Drive. I want to thank the school board and administration for listening to myself and other concerned physicians and parents in revising the school plan to mandate masking indoors. I'm excited my child will hopefully have the opportunity to return to the hybrid option in the next few weeks. In addition to face masks, myself and other physicians, parents, and teachers in Radnor have made it known we feel temperature screening at the entrance to buildings is also essential to a safe return to indoor classes. Temperature screening at entrances is a safe way to help ensure that kids and staff in the buildings are asymptomatic. I also know teachers and staff want to feel safe, and so I would think that they will be willing to help facilitate. As a doctor working in this pandemic, I have seen people lie about symptoms time and again. I'm a part of a physician group on Facebook, and we all agree that unfortunately a large number of people are untruthful when it comes to symptoms and fevers, and we have seen this in our practices. It is very difficult to contract coronavirus from asymptomatic people who are positive when both are masked and socially distant. But once someone with symptoms or a fever gets into school, it will be a disaster, trying to contain and quarantine those exposed. Temperature screening at the entrance ensures all who enter are truly asymptomatic. The medical centers and doctors' offices that have been successful and fully operational throughout this pandemic have been temp screening. They temp screen at daycares, many private schools, nail salons, doctors, and dentists. I don't know why this would be controversial. Again, thank you for your time, your service, and hard work trying to get kids back to school safely. Sarah Bradley, 404 Conestoga Road. Thank you for your hard work and thoughtful reopening plans for the hybrid model. As lunch must involve students without masks, it will be the part of the academic day with the most risk. Athletics, other maskless extracurriculars, and buses being the other higher risk areas. Could you please detail the concrete safety plan procedures for how lunch will be administered at both RMS and RHS? Julie Morris, 306 Hilaire Road. Please approve the hybrid model and let our kids return to the classroom. It's been consistently stated that the benefits of kids being in a classroom far outweigh the risk of contracting and being sickened by COVID. Today, as was the case in July, the hybrid model serves all families in our district by giving everyone the option of in-person or virtual schooling. Today, as was the case in July, both the Radnor administration and school board devised a plan that allowed children and teachers to safely return to the classroom. Today, as was the case in July, the overwhelming majority of families in Radnor want their children back in school. The only difference today is our children have lost weeks of in-person instruction. Again, I will ask the board to vote in accordance with the wishes of the families they were elected to serve. It is not insignificant that 18 months ago, Radnor was a leader in pushing back the start time at RHS. It is disappointing that this board did not feel as compelled to lead on the subject of in-person instruction. If Lower Merion, whose student population far outweighs that of Radnor, can move forward with a hybrid plan, there's absolutely no reason why Radnor can't do the same. Stan Lindgren, 27 Northwoods Road. I support the plan to reopen RTSD schools beginning September 29th as presented by the administration. It, along with the administration's original approved plan to begin the school year with a hybrid attendance option, prudently addresses all risks and concerns with in-person education during this pandemic. The Reopen Radnor Safely Now group has provided an exhaustive list of medical, mental health, pedagogical, and financial benefits to students and families through classroom instructions. When those benefits are juxtaposed against the risks to students, educators, and the community, the choice is clear: reopen Radnor safely now. The board should also...
Mr. Pacitti, the comments about the sports can be read next week.
Got it. Okay.
Thank you.
Next, from Dr. Sarah Maggette, 622 Glen Mary Road. We know you all have put significant time and effort into doing what is best for our children and families in Radnor Township and are grateful for your service. I believe we are all in agreement that we want what is best for our children. As a local mental health provider with over 20 years of experience working with adolescents and young adults, I believe there are numerous reasons why we need to get our kids back into the schools in person as soon as possible. Here are the reasons I believe it is imperative to return the students to school as quickly as possible, particularly our middle and high schoolers. Prior to COVID-19, there was an epidemic of anxiety and depression for our 10 to 18-year-olds. This has worsened over the past 6 months. We will continue to see the long-range effects of this pandemic in what is being referred to as the fourth wave. What I find most alarming is the increase in mental health issues among those students who have no prior history of psychiatric illness. 50% of diagnosable psychiatric illness begins before the age of 14 and 75% before the age of 24. These are consequences that may impact these youth for their entire lives. It is the prolonged nature of the situation that will result in more persistent mental health issues, even with a return to school. Unpredictable, never-ending anxiety is the worst type of stressor. Adolescents need routine and a sense of control over their world. The school setting provides them with a sense of normalcy and routine, which can ultimately help to mitigate the negative consequences of the pandemic. They look to their peers and more often than not their parents for support, reassurance, and adaptive coping. With increases in domestic violence, substance use, financial strain and loss, and divorce associated with COVID, our children may be exposed to significant stress and, for some, violence in the home. For some students, the school setting is the most safe place in their lives. It is crucial for our students to resume in-person school to ensure that the collateral damage of COVID-19 is as limited and short-term as possible. Our teachers, staff, and administration are the supports our students need to feel safe, grounded, and supported. We believe in the plan that Radnor has developed and trust they will keep our students safe. Thank you for your time and attention. I'm always happy to discuss this critical situation further. Suzanne Bowers, 4 Hawthorne Lane. As we start virtual school in the Radnor Township School District, we, the undersigned oral surgeons, orthodontists, dentists, and our staff feel compelled to express our opinion regarding the importance of an in-person education for the children of our community. There's absolutely no substitute for being in an actual classroom surrounded by peers. The emotional, educational, and social well-being of our kids is being compromised, and we feel that this is a far more damaging than the risk of the coronavirus to their health. As an oral surgeon, the lead signatory, John Voinier, DMD, MD, has had the unique training that require graduation from both dental school and medical school. This education has afforded him the knowledge of disease processes and provided him the ability to weigh the benefits and risks associated with the coronavirus at a professional level. His practice was closed for nearly 2.5 months earlier this year. Although he was in agreement with the closure of society at the time, in his opinion, the coronavirus morbidity and mortality data, especially in younger people, supports reopening. His practice opened fully 3 months ago. Dental professionals are some of the highest risk for exposure to the virus. They implemented social distancing guidelines, PPE for all employees, temperature checks, and COVID questionnaires. Dr. Voinier is happy to say that there has been no office exposure or case of coronavirus during this time, despite treating thousands of people. He does realize that this could change at any moment, and the risk is still there. The bottom line is that he is glad that they were able to responsibly open doors and provide needed treatment. The same logic can be applied to the schools. It is certainly not clear what data points the schools are using to determine the right time to reopen. There will always be a risk of exposure to the virus, and we have to decide how long to keep our kids sidelined. We have to ask ourselves if the damage that is being done to our children in the future of this country is justified. In our opinion, it clearly is not. Local professionals in the dental, oral surgery, and orthodontia professions joined Dr. Voinier in urging schools to reopen for Radnor children. And let me check the email. See, this could be the last one unless some came in during. Yes, we have 2 more after this one. They came in. Esther Kellerman, 809 Lawrence Lane. Hello, school board. I am parents of both elementary and high school children, writing with 2 quick points to consider. One, as discussed in earlier meetings, the effects of Labor Day weekend are crucial to see how the virus is spreading in our community. with Labor Day on the 7th, giving a full 2 weeks from then will be the 21st, assuming that test results are turned around quickly, and assuming that numbers through this Thursday are included, then this Friday the 25th would contain the data that more accurately encompasses Labor Day weekend. 2, regarding lunchtime for the high school, this is not an issue as the elementary kids are home for lunch. If they are eating inside the building, are the kids able to spread out enough so that kids are not eating in the same spot as earlier lunches? For example, kids in A lunch socially distance, take off their masks obviously to eat, then kids come in immediately after for B lunch and sit in the same spot without a mask, breathing in the air from the previous child in A lunch, and so on for C lunch. If the kids can be spread out so that only one person eats in that area per day, then there is much less of a chance of inhaling any aerosolized virus that remains in the air for hours in an enclosed setting. If eating outside is possible, that is even better. I know the district was looking into tents, but that will only be feasible until it gets too cold. Let's see. From Patricia Constantinian, 783 Robin Hood Road. Members of the Radnor Township School Board, a group of RTSD parents and caregivers has been agitating to reopen schools, pushing to, quote, give parents a choice, give students a chance. This is evidenced not only in neighborhood signage, reopen Radnor schools now, but also in social media platforms intent on grandstanding opinions to advance a seemingly singular agenda. A petition letter directed to the school board titled Reopen Radnor Parents and Caregivers has been circulating and has gathered several hundred signatures. Many of the arguments presented neglect to consider all viewpoints. According to the Reopening Radnor FAQ page, specifically Human Resources, RTSD staff would not have the option of working from home if their circumstances necessitated them to do so should the hybrid model be implemented. As the mother of 2 RTSD high school students, I'm ready to expand and possibly to balance the debate to include parents who are concerned not only for their family's safety, but also for the safety and well-being of our exceptional teachers, dedicated administrators, and caring staff members who make Radnor schools consistently excellent. This pandemic has made acutely apparent that Americans are in desperate need of a social safety net that provides families with critical support services. In the absence of such, public schools have long been burdened with many functions characteristic of a welfare state, with teachers and school staff often performing in capacities well beyond the scope of their training as educators and providing care that they are not formally contracted or paid to do. In addition to educating our children, our schools to be concerned with Radnor residents' economic health. How is economic health being defined by those who drafted the above-mentioned petition to reopen schools? We are fortunate that Radnor teachers are willing to wear many different hats, but an entire economic system cannot hinge upon their voluntary generosity, nor should they be compelled to put their own lives, livelihoods, and families at risk. The reopen petition also raises concerns about students' social, emotional, and behavioral health. Noted on social media are calls urging parents to send school board members photos of their struggling children. You may have already seen such photos, but I'm offering an alternative visual of school at home. My 9th grader, after taking a virtual summer math class at RHS, moved seamlessly into a fully virtual learning environment and is happily engaged with his teachers and classmates. I also have a 12th grader with ADD and anxiety who is enjoying and even thriving with the current home-based school model. As I've thought about our home experience, I'm aware that many of the pernicious social, emotional, and academic stressors of high school are considerably muted. Both children are sleeping longer, eating better, and spending more active time outdoors in fresh air and sunshine. They continue to connect with friends either in socially distanced person or via Zoom. Many students and their families have expressed outrage at the suspension of athletics. It is worth noting that school-based sports programs are absent in most parts of the world. Nevertheless, high school students in Europe, Asia, and elsewhere lead active and healthy lives, participate in team sports outside of school, and even rise to the level of becoming professional athletes and Olympians. In continuing to address concerns regarding students' health, some families have been citing the emergence of mental illness, such as depression, in their children as a consequence of online schooling. As a clinical psychologist, I can state with some authority that depression, as with any mental illness, is a complex condition with components, including genetic vulnerability, that likely predate the arrival of COVID-19 and the prolonged closure of schools. While there are effective medications and evidence-based therapies for depression and frequently comorbid anxiety, there are as yet no such treatments for this coronavirus infection. Teachers and school counselors are not equipped to diagnose or treat mental illness. There are, however, many options for parents and caregivers to access telehealth-based mental health treatment. In our new reality, COVID-19 is going to be with us for at least another year. Rather than hyperbolizing feelings of sadness and grief as mental illness, might we view our current situation as an opportunity for children to learn to adapt to adversity and to evolve in their altruism toward others. How important it is for us parents to support our children in this endeavor. As you move to reopen schools in the face of unrelenting parental pressure to do so, I hope you will consider that it is my strong opinion, shared by many other parents, caregivers, that the option to teach, work, and learn from home should be available to all members of the Radnor school community until a safe, evidence-based, and vaccine-supported method of returning to in-person school attendance is available. We cannot afford to sacrifice one child, teacher, parent, grandparent, caregiver, or family member. From Kevin Geary for Blackfriar Road. Dear Board, I would like to thank Ken Batchelor and his entire team for the leadership they have shown throughout this time. I urge the board to pass the reopening plan and do so unanimously to show the township that its school board is finally united in sending our children back where they belong, in person and in school. I also urge the board to begin looking at allowing clubs and sports to begin more regular meetings, practices. This is a sports comment, looks like. Okay.
Yep, great.
Yep. That's it.
Super.
We're
Thank you
saving-
so much.
And we're saving our sports comments for next week, just if anybody's just joining us, they wonder why we did that.
Yep. All right, Mr. Petiti, thank you so much. Mr. Batchelor, if you could move right into your report from superintendent. I don't know if you have much of a report before the priority action discussion action item.
I do. Thank you. Good evening. It's good to see everyone. And I know we have a lot of our community, tuning in as well tonight. And thank you again for the public comment. And I just wanted to go over a few things quickly before we get into the presentation. Some of what I'm going to share is going to be a little bit repetitive. That what I'll share now, I'll go through more quickly in the presentation before we get to our agenda item. But I just wanted to review, based on the public comments, some of the comments I've just heard, and just some of the conversations I've been having, with so many in our community. One of the questions that has been continually asked of me is, what changed from July 28th to August 18th? On July 28th, we as a community, as a school board, as administration, we developed 3 phases, and we voted to begin our year in the hybrid phase 2. On July 28th, when we did that, we talked about the fact that we need some type of guardrails. We discussed what would those guardrails look like? What are the metrics that are going to guide us that if we should need to move to phase 1, phase 3? And we talked about that. We talked about the fact that our health department and the state were going to provide that to us, that they were indicating at that time, at the end of July, they would be providing that to us. Between our vote on July 28th and then August 18th, some things changed. There were some major changes. One big change was, yes, we were given those metrics finally, and we were given those guardrails. The other huge change that happened was our local health department that governs our county. It's the Chester County Health Department. And again, we've talked about this before. Delaware County didn't have an active health department, so our county contracted with the Chester County Health Department, and they are responsible and have the authority over both Delaware County and Chester County. And our health department, between that meeting on July 28th and then August 18th, recommended that every private and public school district and school in both Delaware and Chester County begin the year virtually through October 9th. And everyone I've talked to has expressed, when I talk to people, how do you not go with that guidance? And that was the dilemma that this board, this administration, and we were all faced with as we went into that August 18th meeting. The department did give 3 reasons for why they were doing that. One of the reasons was the escalating positivity. The positivity rate was going up at the end of July, and there was a lot of concerns that it was going to continue. We brought Dr. Rubin, Dr. Brennan to our board meeting to talk about that. in early August before the August 18th meeting. There was also concerns that what we were seeing as a 6.5% positivity at the end of July that was rising, that it would continue to rise. There was also concerns that Labor Day was going to add another impact to our positivity rate. And there was concerns that end of summer travel would play into it. The third factor was a district's readiness. How ready would a district be to have kids come in? We felt confident that we had the third piece, that we were ready for our students to come in. But the health department and the doctors we're working with were also trying to share with our communities the importance of having the numbers as low as possible when we start school so that we can be more successful in keeping school open. When we went into that August 18th meeting, what changed then was we did have three options on the table. And one of those options was continue with hybrid. But administratively, we recommended an option that had us starting online, that had us starting honoring the Chester County Health Department. I want to show you the presentation just for a moment from August 18th. And Michael, if you wouldn't mind, or Chris, I'm not sure who's sharing the screen, but if you could share for the superintendent's remarks just quickly what we discussed on August 18th. And on August 18th, we did show three options. As much as all of us wanted to see our kids in school, as much of all of us, board administration, had been so committed to our hybrid plan and had been so committed to figure out how can we successfully and safely have our students back in school. That guidance from the Chester County Health Department, and I'm going to refuse to use the word pivot because I think I've destroyed and used the word too much. I had some teachers, it was pretty funny, share with me if you're a fan of the TV show Friends, there's a great scene where they're carrying a couch up a staircase. Look it up, and they're yelling pivot, pivot. So I will hold off from trying to use the word pivot. But what forced us to change was that advice from the health department, and this is important to understand as we move forward. That advice from the health department that encouraged all public and private, and many private schools changed as well and started the year virtual. And they asked us to start the year virtual, recommended through October 9th. We at that time on August 18th said, okay, if we're going to honor this and look at this, and if we're going to move forward, how then do we potentially move out of this? Because there was a lot of conversation at the time that will we ever have kids in? And this board, this community has been united in that we wanted to give our community from the get-go options and a choice. And yes, some of our families, if we heard from the public comment, chose cyber and chose to be online when they had a choice between cyber or hybrid and chose to be. And there is a strong voice. 30% of our elementary parents chose the cyber program. And yes, while 70% at the elementary chose the hybrid, many of those families as well still express concerns about making sure that we as a district are taking all the steps, as you heard from the public comments, to be as safe as possible. So we honored that request from the Chester County Health Department, but we shared three options. And administratively, I said I did not recommend the first option. And that first option was 2A. 2A just put the stagger going too far out. Now, why are we staggering? It's another recommendation from the health department. They said, look to stagger once you return students. We then looked at 2B and 2C. I should have flipped them because it's better to be with you than to see you. Sorry for my lame jokes, but I should have flipped them because I think what the plan that we all liked a little bit more was the 2C. And the 2C put the earliest possible opportunity of September 22nd out there as an option for us to reassess. And ultimately, that's what our school board decided to do. We took the vote to move to phase 3 based on the administrative recommendation. We took the vote to move to phase 3, and then between the choices of 2B and 2C, we selected really 2C, that we would meet on September 22nd instead of September 29th, and we would look at the data. So that's what changed. And it's really important to understand that because this is going to continue as we move forward. So what has changed now that we're willing to bring students in prior to October 9th? And you will see even on August 18th, we had a model out there in 2C where we were willing to put out there the potential to bring students in, especially our youngest learners, prior to October 9th. But that model and that plan was all contingent on the fact that the metrics, the guardrails that we have now, would be trending in the right direction. So what has changed once again? And I'll go to the next slide for a minute. What has changed again is our metrics, and we're continuing to track these each week. I meet with the health department each week. I meet with other doctors and medical professionals and other superintendents every week, as well as our staff and others in our district as well. But I meet with them to track this closely. And then we are sitting in public, we've published this each week as well. If these metrics were different right now, we would not be putting out the recommendation that is out there right now. So our families need to understand the importance that these metrics play, these guardrails that both the state and the Chester County Health Department has given us based on positivity and incidence. And the positivity and incidence, those two items together, and I have other charts in the next presentation I'll share with you, these are what are guiding us. And these are what are giving us the opportunity now to adjust, I didn't use the word pivot, to adjust even more. And not only to go with that August 18th recommendation that maybe September 28th, but we believe we have a moment right now based on these metrics. We have a moment and an opportunity, and yes, it's been 2 full weeks. We're just starting now the 3rd week of online. So after 2 full weeks of our students be online, we're ready to put together a plan that next week brings all of our students back. And we feel comfortable that we're doing this in a safe manner. So again, what has changed, if we could leave the presentation for a minute and go to back to the full screen. What has also changed, and I got rid of my background so I could actually hold this up if you can see it, but this was Saturday's Philadelphia Inquirer, the front page. And experts say it may be time to return students. But it was hard for me to read backwards. Dr. Rubin has given 2 workshops. We brought Dr. Rubin and Dr. Brennan to our board meeting in August. And I know people were dismayed that as we were listening to what was happening, but we have been tracking very closely and I cannot thank enough Dr. Rubin and Dr. Brennan and the health department for their dedication to work with and support school districts moving forward. If you tuned in last night to Dr. Rubin's presentation, our staff, if you tuned in last Thursday, and this report in the Inquirer talks about experts are saying that we have a window now because our metrics have stabilized. The positivity rates that were concerning us at the end of July, thankfully, continued to go down. We're 2 weeks post Labor Day. No, we're not 4 weeks like the health department had mentioned, but we're 2 weeks and we're seeing enough of a stabilization and we're not seeing a spike after those 2 weeks that the medical community is supporting us with the idea that there is a window of opportunity now for us to get our kids in. And Radnor, thankfully, we're ready for that. We're ready for that, thankfully, because of our teachers. Our teachers have been in their classrooms for these first 2 weeks. If they hadn't been in for the first 2 weeks, helping us troubleshoot, helping us plan and get our routines, we wouldn't be in a place where we could put together a plan that brings all of our students back next week. If our school board hadn't put in place this opportunity for us to meet on tonight, September 22nd, that opportunity and the tracking of the metric gives us an opportunity now to return our students. Bringing our special ed students in. We started bringing special ed students in not only over the summer and not only over the summer math, but bringing our special ed students in, some of them, not all of them, over the last week and this week, additional students is helping us as well. I walked around our elementary buildings today. Our teachers are eager to see their kids. They want them back. They're ready for them to be back. And our protocols are in place for us to do that. We will have challenges as we do this. We're going to continue to have to monitor the data, but I wanted to share this also in a context of, I'm going to have another meeting down the road. I hope not, but I will have another meeting, I'm sure, where I'm going to be explaining what changed. What changed? I'm sure something is going to change. My 2 older guys are in college. We've told them we don't want you home. Stay in college, stay as long as you can. But I know most of the colleges are sending all the kids home Thanksgiving. And most of the colleges are ending their semester, those that are still in Thanksgiving. And I don't like to blame any group, but I imagine with the holidays, with families getting together, college kids, we could be looking at potentially, if the positivity of the incidents going on those charts goes up, We could be looking at a 2-week closure at some point, or a 3-week closure. So it's even more imperative, knowing what we know today, knowing what we have tracked the last couple of weeks, knowing what we knew in August, it's even more imperative now that we do open up our schools now to the hybrid. We get our students in so that if we have to close in the future, we at least have this time period that when we can have them in, we can capitalize on this. And again, I can't thank our support staff, our teachers, our administration, so many people that have had to work so hard to make us be at this point. And you know, this isn't about comparisons with other districts. Every district is different. We are able to do what we can do because of our staff, because of our community, because of our administration. And so we're excited for the plan today. We're cautious about it. We're still hesitant about it. None of these decisions are easy. All of these decisions are difficult. And I will tell you that our community and our school board represents a wide variety of opinion on this topic. This is a challenging topic for all of us as we move forward. So I wanted to just share that. I also wanted to just let everybody know that sports, I know there's a lot of passion around sports. We're not going to talk about sports tonight, and that's a decision I made. We're not talking about sports tonight because our focus tonight is to get our schools open. We set this meeting on August 18th to get our schools open, and that's our focus and our priority is to get our schools open. Doesn't mean that sports aren't important. We will meet and talk about sports next week. I sent a message to our high school families yesterday, and I didn't send it K-12, and probably should have sent it K-12, but what has changed with sports is up until a week ago, the Central League and all of us were committed to trying to get a season in starting January 1. We wanted to see our students be able to compete, and we were looking for an alternative season. And one of the things we were basing that on is the health department was recommending not to start competitions until after January 1. That guidance has changed. Like so much we are experiencing with this, things continue to change. And that's part of what we have to be ready to react to. So now the Central League has reacted to that change. Obviously, our kids and our families who want to see the kids involved in competitions, they are seeing that as well. And each school in the Central League now has to look and decide for themselves, what does that mean for them? So the Central League has put out a staggered, modified schedule for the fall. Radnor will take a look at that next Tuesday at our board meeting, and we'll discuss what that means for us after we first and most importantly get through tonight's meeting on how we open up. That discussion next week will not preclude us from anything. It will be timely. I just ask that as we take the time to look at that and digest that at the end of this week, that our athletes and our parents involved with athletics, be patient, and we'll look at that on Tuesday. That was really the things I wanted to highlight, and then I'll repeat some of this during the presentation, but I want to thank everybody for indulging me, and thank you for letting me share some of that information. That's all I have for Superintendent's report.
Thank you, Mr. Batchel. I appreciate that. Okay, so as we move into our priority discussion action item, I think, Ken, do you want to have Dan and Sean, Mr. Bechtold and Mr. Dukevich give pull up that presentation that you have online?
Yes, yep. So we'll pull that up right now, and we'll move through it quickly, and then we can get to the agenda items. That makes sense?
Sounds great. Thank you.
All right, I'll kick us off quickly. So we're going to try to go through this presentation quickly. A lot of it you have seen before, so we'll go through it very quickly. I don't know if it's being shared the way everybody's seeing it the way I'm seeing it, but if we can move it, it's not the full screen, but that might be fine for YouTube. So whoever's sharing the screen, if it's Chris, whichever works best for you, we're seeing just one slide at a time, one slide, and then all the slides on the bottom. But so our agenda for tonight, and I'll pull out my copy I have here as he pulls it up. Go ahead, you can go to the next slide. Is to talk about the health guidance, the metrics, which I've already shared a little bit, so I'll go through those quickly. Our review of our opening phases. I shared a letter with our community on how we would like to reopen Radnor, and again, why this is the right time to do that. Our phase 2 summary, and then any questions from board members as we get into the agenda item. Go to the next slide. So just want to update our board and our community. I want you to take note of the dates on the top. This is the guidance from the health department, and this is going to be normal and it's going to continue to happen. Look at all the dates. Look at all of the revisions. That gets back to, again, that discussion I just had about what keeps changing or what's changed. Well, look at the updates: July 3rd, July 6th, July 22nd, July 31st, August 14th, September 1, September 14th. This is the health department's guidance, and it changes just like information from the CDC is changing. Just like we learn more about this virus as a country, we're adjusting and adapting, and this will continue. We'll continue to see this evolve and change. The most recent updates were September 14th, where I talked about there's the change with the sports. There's also some changes about in bringing students back. That there used to be the 0.5 over reduction in positivity over 3 weeks. That has now been removed. Now it's about just being within the guardrails, but they also emphasized and put in there what type of timing we should have for transitioning. And so that's important as we move forward too as a community. We're going to continue to watch these guardrails, but we're just because we see 1 week spike really high or we see 1 week go down really low, which we'd love to see, it doesn't mean that all of a sudden we're changing that following week. So we are going to try to look at 3 consecutive weeks or at minimum 2 consecutive weeks as we make adjustments as we move forward. Can you go to the next slide? This again is we've been sharing with everyone. This is based on the PA Department of Health and the PA Department of Education. These are the guardrails that I talk about so often, the guardrails that they created and where we are of last week. And thankfully, and let me tell you, I was waiting all week last week to figure out what was the positivity, because that number was going to impact us and impact that hitting send on that plan for Friday night that we sent out. So we were hoping that the positivity was going to be in the right place, and thankfully at 3.19, the stability we're seeing in Delaware County, that reduction, the consistency we're seeing is good. We want it still to go down. And you can see also in the incidents as well. We're continuing to monitor that. Move to the next slide. Again, this is the Chester County Department of Health. And just as a refresher for everyone, again, for community who's watching, when the last slide, the PA Department of Health and PA Department of Education put out guardrails, our Department of Health put out guardrails as well. And in their guardrails, they did add a 4th category. So where there was just 3 categories within the state, the Chester County Department of Health gave us a 4th to try to help us in that large band in the middle. So now we have a moderate, high, and very high, and to help us with our decision process on whether we should be hybrid or virtual. And if you move to the next page, the next slide, there you can see RTSD was just added, but move to the next slide, please. Again, these are the charts you just saw from my previous presentation, which we continue to track. And as you can see from these graphs, that we are in a place where we feel very comfortable bringing our kids in hybrid. Certainly, an argument could be made as you look at both incidence and positivity. And remember from the last page, the and the ors that are placed in those levels are critical when you have to have both or you have to have one or the other. And when the or is there, one or the other between positivity and incidence, you have to take whichever one is the higher one is the one you're supposed to take based on the health department. But you can see us tracking very clearly in that, virtual or hybrid. You can see us tracking now as low as that in person, below the hybrid when we look at positivity, but we need the incidence to be lower as well. And this conversation also sets the stage. When we move out of that slide, we can move to the next slide, but also sets the stage, and we can we'll hold on that one for a minute, but we can also sets the stage. One of the pieces too we're going to be talking about as a community and as a district is the 6-foot distancing. The 6-foot distancing, that is one of the requirements within the recommendations from the health department, and is critical right now for us moving into hybrid, is what keeps us in hybrid. So for us to move out of hybrid, we would have to reduce that 6-foot distancing. We would either have to see that the guidance or the positivity has changed enough that we're going to be comfortable with 4 feet distancing. We can't have all of our students back in person until we get to 4 feet, but it's something we're going to continue to watch and continue to monitor closely. This again is the slides I talked about in my superintendent's remarks, so I won't go over that again, but I just want to emphasize again to our community why we change, why we changed from July to August, why we're changing now, and why we're going to continue. We're going to have other changes that are come forward as we move forward, as we continue to watch this data. We move to the next slide. So now I feel like I was the warm-up show. This is really what people are paying attention for tonight. As the warm-up act, I will turn it over to the main attraction, Mr. Bechtold and Mr. Dukevich, who have just, as the two in charge of our, each district had to appoint one person or two people to be the pandemic coordinators as part of the health and safety plans. And Sean Dukevich as our director of elementary teaching and learning, and Mr. Dan Bechtold as our director of secondary teaching and learning are doing a phenomenal job leading our district through this, developing plans and working around the clock to adjust. So I will turn it over to Sean and Dan to share our plans. And I do want to just say one other thing about this before they go, though. There is a very funny comedian that has been going around the internet. You have probably seen it, where she pretends to be a principal and talks about all the confusing different plans that school districts put out. We tried really hard not to have a plan that makes that looks a little more, that the comedians will have more, more fodder, more things to joke about. But it will look confusing, but I will tell you, there is a logic to this, and there's a logic that really makes sense. So let me turn it over to Sean and Dan.
Thanks, Ken. I'll start here. And so this slide represents our recommendation for a phase-in plan beginning next Tuesday, the 29th of September. And I'll begin with K2 and 3-5. So our administrative recommendation in K2 is to begin in AM/PM format, which is our phase 2 hybrid, beginning on Tuesday, the 29th, and continuing on Wednesday, the 30th with K2 only in our 3 elementary buildings. And then beginning on Thursday, October 1st, we would add 3-5 across those 3 buildings, so that by the first K-5, all of our students would be in AM/PM format, again, that are not in our current cyber online program. And that would continue again on the Friday, October 2nd, and thereafter. So that is essentially the plan for K-2. It's pretty simple. Again, K-2 beginning on Tuesday the 29th, 3-5 joining them on Thursday the 1st. In the first 2 days where K-2 are implementing, the 3-5 group would continue with our current phase 3 cyber remote instruction. And again, those who are in the cyber program would remain in the cyber program for the foreseeable future. I'll turn it over to Mr. Bechtold to explain 6-12.
Thank you. So when we're looking at September 29th, we're going to be bringing in our transition years, our 6th graders and our 9th graders. And we're also going to be bringing in our 12th graders. We will be bringing in these groups as cohorts. So the A group, we have A and B days at the secondary level, will be coming in the morning. And the B group will be coming in the afternoon. Each group will come for approximately 2 hours, and then we will have a cleaning between the groups. On this day, the 29th, our students are going to walk through what is school like. We're going to have them go through a fire drill. We're going to have them go through a mask break. We're going to walk them, have their homeroom teacher walk them through how lunches work. We're going to really work to show the students how the school works. And so that day will be a day focused on what is the health and safety plan, how does the school operate. Then on the 30th, before I get to the 30th, on the 29th, the students in 7th and 8th grade will have asynchronous work, and the students in 10th, 11th grade will have asynchronous work. On September 30th, grades 6, 9, and 12, we will have our first in-person hybrid day. So 6th graders in the A cohort, 9th graders in the A cohort, and 12th graders in the A cohort will be in person. And 6th, 9th, and 12th that are in the B cohort will be remote, as will be 7th, 8th, 10th, and 11th. On October 1st, we will have the 6th, 9th, and 12th graders in the B cohort that would be in person. And those 6th, 9th, and 12th graders in the A cohort, they would be remote, as well as the 7th, 8th, 10th, and 11th. The goal is to have these students practice what they learned on the 29th. And so we will get a full rotation of the A and B cohort for the 2 transition years and our seniors between the 30th and the 1st. Then on October 2nd, we will be having an asynchronous day for grades 6, 9, and 12. And grades 7, 8, and 10, 11 we will be doing the same thing that we did on the 29th. We will be bringing them in on cohorts, A in the morning, B in the afternoon, and they will be going through, how does school work? What do I do when I need to go to lunch? What do I need to do if how does the library work? How does the building operate? And so we will go through that with them on the October 2nd. And then on October 5th, we will have all students grades 6 through 12 that will be beginning our A-B hybrid rotation, starting with an A day. So all the students at that time will be in the A group will be on the 5th, and then we will flap that on October 6th. We'll have the B group students that will be in person on October 6th. And those that are not in person will be learning remotely via live stream. So that is the secondary plan.
If I could just jump in there and again, one of the importance of this plan at all levels, K to 12, is that school, it looks different. Our students need to be prepared, need an orientation, need instruction on hygiene, on screening, on distancing, on masking, on, as Mr. Bechtold said, how to operate at the middle school and high school, the cafeteria. There's a lot of orientation and there's a lot of time we have to go through to review our protocols. And that's what this time is going to be. So we don't have to create a special schedule at the elementary to go through the protocols because our teachers have their kids in their class. They're not moving between classes. So those protocols will be reviewed at every level when the kids begin with us, K to 12. But in order to do it at the middle school and high school, we're going to have to do it in homeroom and advisory. And what that means is then we can't have classes running the rest of the day because the teacher who's running that homeroom may be teaching social studies classes or science teachers in the science class in the afternoon. They'll be with their homeroom or their advisory period. So that's why we are, the term again, asynchronous, or the kids will be working remotely on their own at the middle school and high school on certain days, while all the teachers, or it's all hands on deck, are providing that training on the protocols to our students. In order to make sure our teachers are ready, we are recommending, I put this in my email, this Friday will be an in-service day. That means that the students have off, all of our students, K to 12, both our cyber program and also with our, with our kids who are looking at bringing in hybrid. We'll all have off this Friday so that we can have trainings for all of our teachers, K-12, to be prepared for next week. So I think we can move to the next slide. And just again, you've seen this slide before, a progressive approach. And again, trying to I just want to emphasize again what I went over in my talk before, that this opportunity to shift, because we have to be ready to follow the metrics. We have to be ready to follow too now, not only the metrics, but also what happens within our buildings. I can tell you already, since March, we've had staff that have had either exposures or have had COVID, and we've had to respond. We've had to respond for the staff that have been in the district working. We're going to continue to have situations where students or staff, and there is going to be exposures and spread, and we're going to have to be able to react to that and continue to move forward. There is a point where possibly those exposures could lead us to a partial quarantine of one classroom or one building. All those things could happen, but it will only happen after we have worked very closely with the Chester County Health Department and very closely with communicating to those families that have an exposure and those staff members as well. It's nothing new for us, unfortunately. We've been doing this. We've been doing this as we opened up this summer for our math, as we opened up for our ESY, as we have special ed in right now. We've been doing this, but it is going to now be on a larger scale. And we believe the importance, again, of masking and 6-foot distancing. If I could echo what Dr. Rubin said, if we all are vigilant about wearing our masks, it's going to make a huge difference on the spread of this virus. We could go to the next slide. And again, the whole point of what we created, and this is just a reminder for the board and a reminder for our community of what we created back in July, the 3 phases that still stand and how we'll be moving forward. So I'll turn it back over to Sean and Dan.
Thanks, Ken. Again, this is just a reminder. This slide has been well played over the course of the last several weeks. Again, our students will return in an AM/PM format. Very soon, actually, we're going to release some additional phase 2 transition information that'll be on our website for families, including more finite details around the schedule. Again, pointing people back to what are our cleaning protocols, what are our masking protocols, all those things are available in detail on our website. But as you can see on the slide, again, we shared this many times, social distancing, and as Ken just mentioned, masking, our hygiene practices, our screening practices. These are all things that will now come into play with our students in front of us. And again, our AM PM schedule at an elementary will have a very heavy focus on ELA and math. There will be some social studies and science built into the day, where the students will then have some asynchronous activities the other half of the day, as well as a live special that'll be streamed remotely. And I'll talk later just about some half-day supervised care through Right at School that will also be possible. This next slide, again, is just a visual representation of how the purpose of the phases was to keep cohorts together with the same teacher to minimize change, even when we may have to phase between 1, 2, which is what we're moving into, and then remote, which is where we are right now. I'll turn it over to Mr. Bechtold about the secondary phase 2.
Thank you. Again, we've gone through this a couple of times throughout the course of the summer. We're looking to move from phase 3 to phase 2. Phase 2, we'd have students in the AB model. All of our desks are situated at least 6 feet apart in our classrooms. We are limiting visitors and offsite trips and having no large gatherings. We have 2 cohorts in A and B cohorts, which are split alphabetically, and half attend in person every other day. And we do have cafeteria seating modifications in multiple areas for students to eat around the buildings. Again, this is a graphic of how this looks. So in phase 3, we currently have the teachers who have been instructing, and all the students have been participating virtually online, and it's been live streaming. When we move to phase 2, we will have half of the students in front of the teacher and the other half of the students at home live streaming the class. And the students will rotate between being at home and being in person based on the AB hybrid model.
And finally, as I just mentioned, Right at School, our before-after care provider, currently is providing care for around 60 students district-wide in the elementaries. It is currently hosted at Eithon Elementary in their lodge. Moving to an AM PM format, Right at School will be able to offer care per building out of the gym and cafeteria, which will not be used during regular operations in AM PM format. And a registration link and more information will be coming out from Right at School in the next day or two. And with that, we can open it up for questions.
Great, thank you, Mr. Bechtold, Mr. Batchelor, Mr. Dukevich. Do you want to unscreen share?
Yeah, we can, and as we unscreen share and just open up for questions, our plan, which was developed with teachers and community in the sport with the 3 phases, no plan is going to be perfect. Our plan, though, the guiding principle was that we needed a structure that we could move between, and we really believe that our structure and our plan will allow us to do this, to continue to move between, the 3 phases, and can do it seamlessly. And I want to also just say that, our teachers, I've been walking around, trying to see some of them, our teachers as a profession are perfectionists. They want things to be perfect. They want to do so well for our students. And this is all new. Teaching virtually, teaching in a hybrid model, at the middle school and high school, where you're going to have half your students in front of you and half your students home, and then that's going to switch each day. This is a lot of challenges. We all have to be patient with one another. We all have to, we will do our best, but at the same time, I think we got to be patient and realize that we're going to continue to get better at this hybrid model as we move forward, and the challenges that we have as we continue to move forward, but to give ourselves a little bit of patience, and to give ourselves a little bit of grace as we move between these models, because it's hard. It's hard if you're a teacher who's a perfectionist, who wants everything to be right, and they're passionate about doing a great job, and as eager as our teachers have shared with me that they want the kids back. Some have even commented, gosh, just getting the hang of the 2 weeks of the online, and now we're shifting to hybrid. And how long will we be in hybrid? I don't know. I don't have an answer for you right now, but we're going to continue to monitor that as we move forward. And to our parents, I know that, they've been very patient, with us. And again, there's a wide variety of opinions. We're hearing from our parents in the cyber, and our cyber program is continuing, and you heard it tonight in public comment. I didn't know that public comment was going to be there tonight. The positives with our cyber program and those that have selected it. So that program is going well and is continuing to evolve and improve, but it's far different than the program we offered online back in the spring. So we'll open up now for questions from the board.
Bradley, why don't you go ahead?
All right. Thank you very much. Ken, all of this is really appreciated. Personally, I'm thankful for the idea that you've dispelled the rumor that we yanked the desire to go hybrid away from you. That came from our recommendation. So I appreciate the clarification on that. I have a question about something that's in the current motions that are before us, and this is something I think I talked about with you one-on-one. Moving forward, there's this statement that the administration could move us in and out of phases administratively. So I'd appreciate if you could comment a little bit about that, both in terms of what that looks like moving forward, and also what we've done so far, because I think the idea has been raised that instead of calling for a vote on August 18th, potentially you could have administratively said, we need to take a pause and we don't need a board vote to do that. It could be an executive decision. I think since we did vote, that's why we're voting again tonight. But I'm curious about what your views are on that. Especially because under state law, what we had to do was just the health and safety plan. And it was really just a colloquy, I think, that we had in July about, do we also have to pick a phase to start? And the answer was yes. Moving forward and looking back, how much of this is operational? How much of it is a board decision?
Yeah, so great question. So it is a board, the health and safety plan was a board decision with the administration's recommendation on what should be in the health and safety plan. The decision to go virtual as well needed board involvement and needed a board decision as well at that time. We made a decision in July to go hybrid and to start the year as we developed the plan, and that was a requirement. And the state has put school boards across this Commonwealth in a position that I don't think school boards have ever had to be in making decisions on what to do during a pandemic and whether to have school. So that was something that the board needed to make a decision on. Moving forward, though, the statement that's in there is we will have to look at potential quarantine of maybe a classroom. May have to quarantine, or maybe a group of students or one segment of a building, or maybe a bus may have to quarantine. And the superintendent and the health department will be making those recommendations moving forward. And what I mean by that is we're not going to have to call a special board meeting every time that we have a situation where we may have to quarantine a classroom, or every time we have to quarantine a group of students moving forward. The larger decision to move us from phase 2 back to phase 3 could come directly from just like the superintendent calls a snow day, on his own. I don't do it on my own. There's a lot of administrators that are really critical to that decision, and operation staff that are critical. But we would have a lot of administrators that would be involved with, we may have to move to phase 3, and depending what, is the advice of the health department for why we do that, we would then capture that discussion a week later or whenever our next board meeting is, or schedule a board meeting. So there will be a combination depending the severity of what it is we're looking at. But I wanted the board and also the community to understand that the day-to-day, and if we should need to cancel for a day, if we should need to close a classroom, if we should need to quarantine a section of our community, administratively, we're going to have to make that decision, and we may have to do it quickly in working with the health department.
All right, thanks. That's very helpful. And by the way, that makes a lot of sense to me. Some decisions are decisions for the chief executive. They require fast action. So I think you've helpfully distinguished between setting policy versus making operational decisions. I have a question about where we are now on the 22nd, 2 days after Labor Day. it was your recommendation to start virtually came from this anticipated Labor Day bump based on what had happened in Memorial Day and the July 4th holiday. What have you heard from the health department and the other physicians that you consult with about whether those 2 weeks of data are enough to conclude that the bump's not there? I mean, I'm thinking back to our December or January meeting. There was all of this discussion, and members of the community said Labor Day is a big deal. It's such an important holiday. Don't start school before Labor Day. But we didn't get the bump, and that's fantastic news. And I'd like to hear how much confidence we're hearing from the experts that you talk to about the fact that we don't need to worry about that.
Yeah, and I'll go back and just show it again one more time. But really this article from Saturday was really talking about what Dr. Rubin talked about, that the time is right now. Now, why are the medical community that has been guiding us changing now? They're changing because they didn't see the spike. Trends are everything in this discussion right now, and based on what they're seeing with the trends, that this time is now right. And I think there's also a realization, we're learning more each week and we're adjusting. There is this realization now that, because the metrics are low and we didn't see the spike, we'd like them to be lower, but because of where they are now, that we can open up school. I think there's also this realization too that, we don't know what's going to happen in November. So we need to take advantage of the time we have right now. We were smart with what we did. There was concern, based on the health department, based on what they saw happening. We were able to ride out those first 2 weeks. Your point's a great point, that we haven't seen the last 2 weeks yet after Labor Day. Why did the health department pick October 9th? Because they were picking what was the tail of what they saw after the 4th of July, and they felt like they didn't see the full impact of 4th of July until about 4 weeks after. But what we know now from the 2 weeks after Labor Day is that we are seeing a trend and less of a spike and less of a concern than they saw after the other holidays. So that, if we had seen a spike, in which we could have the last 2 weeks, we would be talking about something very differently right now. We'd be having a very different discussion right now. But because we're seeing the metrics that we're seeing, because we have protocols in place, and that the other message too is that, the trusting of the protocols. I think districts now are more comfortable with the protocols, comfortable with having in place, having our teachers in. We are more comfortable with the protocols. That time with just our teachers, I really think has paid off. It's been very valuable for us that we know that our protocols are in place and that we can move into this next phase with making sure that we're following those protocols closely and don't get laxed on them. I think that's going to be our other challenge. We can't become lax. So long-winded answer, but it is really that the looking at the metrics and how the metrics have played out in the 2 weeks has shifted the medical community's opinion and has encouraged us that if we're ready, they're supporting the idea that districts need to look at this time period now, look at this time period differently.
I also have a question about how the recommendation shifted from some of the ideas we had on August 18th to what the administration is recommending tonight. And I'm thinking a little bit, just it's an example, it's not the only one. The CHOP Policy Lab guidance said when you're at the range of 10 to 35 cases per 100,000 in a week as your incidence rate, you should look into an incremental approach where you start rolling the younger kids into the building first. And yeah, you alluded to some of the webinars that CHOP Policy Lab has done in conjunction with the DCIU, where they've said, if you're at 50 per 100,000, which is where we are, or maybe just under that now in Delco, and you've stabilized, maybe that's close enough. And back August 18th, your main recommendation, I think, had been for 2C, which had this, week-long staggering, starting with, K to 2 a week, 3 to 5 another week, and then everyone else. So how has your thinking changed in terms of, why that staggering is not something you want to emphasize in this current recommendation?
A couple of reasons. One, it's changed again, not to be repetitive, but just because of we're living and seeing what the metrics really are. So I think if we saw metrics that were higher, we need to adjust. If the metrics were higher, maybe we would only do K2 for a week or so. So I think that's a piece, seeing where the metrics have stabilized, that's given us more confidence. Having our teachers in, I've shared with that as well, but that we feel we've got our process and our procedures in place, to move forward. And also the window of opportunity that the medical community is seeing right now. As I mentioned before, I wouldn't be surprised if we're looking at a closure in November. I wouldn't be surprised at some point, that whether it's October, November, we see a spike in our community, and that because of something maybe going on, particular in Radnor, maybe it's something that's going to happen within the county and the positivity rate increases, and we need to close for 2 weeks. That may happen, and we have to be prepared for that. I hope it doesn't happen. And I would hate to lose valuable time now. I think we're wise in what we've done, but we've gotten to this point. Lose valuable time now in a staggered approach that would put us possibly closer to a future closing, when the staggered approach being so prolonged for us particularly isn't as necessary. Remember, the health department guidance was based on 3 things. And one of those 3 items that was absolutely critical was a district's ability to be ready. So we can meet that. We can meet that to be ready. The second is the metrics, and we're seeing those metrics have stabilized. So that third piece was the Labor Day, and seeing that the 2 weeks haven't provided the Labor Day. Yeah, we're making a judgment call. We're erring on the side of these 2 that we know are strongly in place. And we're going to have to watch what happens with the metrics the next 2 weeks as well. But we feel that we are, as a district, this is an opportunity for us, to bring our students in and to do it safely.
Another question I have about these recent conversations you've had with the health department, the other doctors advising you. You had mentioned down the road, the transition from phase 2 to phase 1 and what that might look like. What's the latest you've heard, if anyone's even talking about it, about what kinds of cutoffs or data that these experts might rely on for them to say, we don't need that in the guidance anymore? Is it something like the 10 per 100,000 we've seen in some of these documents? Has this been discussed at all? I'd love to give parents hope that phase 1 is something that could happen this year, and it's not just that it's the fate for us is phase 2 at most for the whole year. You're muted.
I know, gosh, and now I'm no camera. All right, there we go. I think that, could we be in hybrid all year? It's possible. It is possible that we're in hybrid all year. Is it possible, and unfortunately, I know somebody's going to run with that now and say, oh gosh, superintendent says we're going to be hybrid all year. That's not what I'm saying. I'm saying it's possible. Is it possible that we can get to in-person this year? I do think it's possible too. That is something that could happen. When I talk to different medical experts in our community and the experts that I meet with weekly, what needs to change is a couple of factors. One, the 6-foot distancing. The 6-foot distancing is what requires Radnor to be in that hybrid. If we didn't have that 6-foot distancing, we could be doing the masking, the hygiene, and the screening and have all our kids in. The 6-foot distancing is what really makes a difference. We could get to 4 feet with all of our students, and we know that we could do that. And a lot of districts couldn't do that. So we're lucky that we have that opportunity that we could have all our kids back and get to 4 feet. So what would have to change? Well, remember at the beginning of the meeting, I showed you the Chester County Health Department guidance, and I showed you all the different dates it's changed and evolved. And that early guidance listed 3 feet. So 3 feet was in the earlier guidance as a minimum, and it was a 3-foot minimum. And that was what the World Health Organization had put out, was a 3-foot minimum. And then it was a 3-foot minimum, but to go to 6 feet to the extent possible. Do I think that the guidance could change again? Well, certainly. Look at all the times it's changed already. It could certainly change. What would drive that change? This is just Ken Batchelor. What's my feeling on it, and from asking questions, is what's going to drive it is the positivity is going to have to go down. So as we see positivity and incidents go down in our community, I think that is going to drive changes within the health department's guidance. I think the other thing that's going to play into this discussion is our success at hybrid. We feel good about the success we had with summer ESY and summer math class. We feel very good about having our special ed kids in last week, more kids in this week. Wasn't without challenges, wasn't without adjustments. but what we are learning from that. So once we're into hybrid, believe me, we're going to be monitoring and watching closely and say, what are our opportunities? Do we have an opportunity, both looking at the guidance and the positivity, but also internal to our district? Do we have an opportunity, and do we potentially have a tolerance for going below that 6 feet? Does it make sense? And time will tell, and we're going to continue to have discussions and look at that. So I hope so. I don't think anybody wanted to, I don't think there's anybody who wants us to be in hybrid all year. So that's something that's going to be the next piece that we will be discussing in the weeks to come as we move forward.
And are any buildings closer than others to 6 feet, given enrollment? I know you talked about elementary had 30% sign up for the cyber, but I remember, the hot issue of the day months ago, feels like years, was, the enrollment in our elementary schools and how that was rising. Does this vary from building to building?
I'll let Sean and Dan jump in a little bit, but I would just say, and you guys tell me if I'm wrong with this, I don't think there was a huge variability. There were specific areas in each building that became a challenge, whether a lab at the high school room versus, a specials room or a certain room in some buildings, but we were fairly consistent across the district that we could reach 4 feet. And it's a little bit more than 4 feet distancing with all our kids back. And that was fairly consistent that in order to get to the 6 feet, we needed the hybrid. But once we have the kids in hybrid, we're going to have an opportunity to actually see the bodies in the room. And we've got the desks and all the stickers and all the things placed out right now and all the lines. And I mean, it's really pretty incredible what our principals and our custodians and our operations team have done to set up the rooms. But once we get the actual students, we'll be able to make another assessment as well, because it adds a little bit more clarity seeing the actual bodies. Is that a fair, Sean and Dan, summary of that?
Absolutely.
Yes, we we are very comfortable at 6 feet right now in the hybrid phase. And when we looked at this at phase 1, we can get at least 4 feet. In some classrooms, we'd be able to get 4.5 or more feet. So specifically for the secondary level.
That's all my questions. I have a few comments. I'll save them for later.
Great, thank you. Do we have anybody else who would like to ask questions? Jeff, go ahead.
I think my only question for now, Mr. Bachelor, what has the administration recommended as it relates to screening? I know that was a question, some public comment. Didn't know where we netted out. At one time we were talking as a board with you and the team about an app, perhaps, or some sort of accountability measure, if you will, for parents to red light, green light, if you will, based on symptoms. Could you just share where we're at as we head into next week?
Yes, and I'll let one of the administrators, either Dan or Todd, jump in. I think Todd, I just saw his mic come off, so maybe I'll let Todd jump in.
Yeah, so where we are is as of late as today, we've been working with the company, and basically we will be sending it out. We hope to have it live by the end of the week. It will be a web-based system, which you can do it on your phone or the computer, and you'll do a symptom checklist. And if you pass it at the end, you'll get a green light. If you don't pass it, you'll get a red light or a red screen, and you should stay at home.
Just another quick question, operational question. It might be more for Dan or Sean, or based on, well, or both. In the hybrid model, with it was more secondary, I should say. So for Mr. Bechtold, when half the group is typing in from home, will the teacher, will they be mic'd? And like, I'm just thinking of the experience that those at home for the day will be having following the class. Will I don't know if the teacher will be masked and mic'd? Just sort of operationally, how's that going to work?
So the teacher will be speaking, we'll have Zoom playing. They will be sitting at their desk, and the desks at the secondary level all have plexiglass around them. So the students that are seated in the classroom will be seeing the teacher screen share for whatever PowerPoint or activity they're doing on the smartboard. We piloted this in our summer school program when we had our math classes that did that, and we actually had students that were in person in front of the teacher and students that participated at home virtually. And so that's one of the things that we really felt was beneficial was testing it out over the summer. So teachers would speak directly into their computer. They wouldn't necessarily have like a lapel mic, but they would speak into their computer, and students in the class would obviously be in the class, but students at home would hear them through the computer.
I'm glad to hear that, yeah, it worked well in the summer. So we have that experience. Thanks, my only questions for now. Thank you.
Great. Do we have any other questions? Nancy?
I just have a piggyback question on Jeff's comment about the web-based system that Todd had shared. Is that information going to be available to the schools so that I know there's a concern of students going to school even if they have been screened and show some symptoms? Like, does that give them access to the school, or is the school going to be checking whether or not they did the app, and then if they are read, whether or not they're there or not?
The building will be able to pull up a report that states who did not do the app and also, or the web-based system, and also who failed. So they know that if they see those students in the building, they should not be there.
Thank you.
Nancy, is that all your questions?
For now.
Okay. Are there any other questions? Liz, go ahead.
My first question, two questions. On the right of school, can you just clarify where that's offered? I know currently it's at the lodge, but which is, an outside building, but is it at every elementary school that it will now be offered?
So Liz, with the AM PM format, it would be really difficult to bus people from a school to Ithan, and Ithan's Lodge is only so big. So right now, Ithan's Lodge can only really, we have 60 students there total, but not that many even in a given day, because they have options to go partial day and 1 day a week or up to 5 days a week. In moving to AM PM format, there is this prevailing thought that we may have more interested families to extend the day. And in each situation for AM PM hybrid, we're not going to be using our cafeteria or gymnasium because specials will continue to be remote, and cafeteria, we're not serving lunch for students in AM PM. So we're going to use those two spaces, one for AM, one for PM, and that way we can continue to keep those cohorts separate, but they would be operating out of each of the elementary buildings based off of registration and interest.
Okay, thank you. And then my second question, it does relate to one of the public comments we heard about lunch at the high school. We know that and in the middle school, that is potentially, the most vulnerable area of transmission. And how are we dealing with cleaning or transitioning from A, B, C lunch?
That's a great question. So we actually did walkthroughs and some tabletop exercises with the building administrators last week. And so there is a single entrance in to the different areas. We've got 3 different areas in each building where we're going to be serving lunches with point of sales to spread out the students. So we'll have at the high school, the cafeteria, the black box, and the back gym that will be having point of sale, that will have food there, and they'll have cashiers there. And at the middle school, we've got the cafeteria, the auxiliary gym, and the LGI. Each location will have a custodian assigned to it. So we'll have 3 custodians at the high school and 3 custodians at the middle school. And so we really, I got to give a lot of credit to the high school and middle school administration. They really thought this out well, and we did get a chance to actually walk through how our plans would play out last week and make adjustments to that.
Thank you. And then one last question, and this is kind of a piggyback to Jeff's. In terms of when we're managing expectations and what this the hybrid looks like when the teacher is teaching from the classroom. So I understand their mic, but can the teacher move around while they're doing their instruction, or will they be, stationary? So
we do have USB dock cams that the teachers have access to. So they will be stationary. However, they have the opportunity to move around the room. One of the things that our instructional team has been working with the teachers on is giving them opportunities to see how they can break up the block and how they can work with students. So teachers will be stationed behind the plexiglass, and they will be teaching that way. However, they can, if they're doing an assignment or activity, they have the ability to put the students in breakout groups on Zoom, and then put on their face shield and walk around and monitor students that are in the classroom as they work in either independently or small groups. So that, as Mr. Batchelor said, this hybrid model is something that's going to be new, and it's going to be something that our teachers have been, thinking about and working towards. We have had special education students in last week and in this week, and so we've already started to work through those nuances. But our teachers have been doing a phenomenal job, and I know that they're going to do a great job with hybrid, and it will continue to get better as we move through through phase 2.
Thank you. That's it.
And
Me.
just wanted to go back for another question, just on the temperature check questions, because that was also a public comment question too. That, we are planning to do random temperature checks as well. So that's another piece that we're looking to do, and also having obviously families do that as well. The reality from talking to, again, the medical community is that the temperature check is not reliable with kids. And I heard a great, the colleges that are opening and still continue to open and function, we're watching very closely and what everyone's doing. And I just learned from a colleague today that a college gave students coffee grinds. And they told the students, if you can't smell the coffee grinds in the morning, don't go to class. Smell and taste are just really have surpassed temperature checks. When you talk to the medical community, that loss of smell or loss of taste has been, has really risen as a strong indicator of COVID. So there's a lot of things we'll just continue to look at to see what can we do to fine tune our screening process.
Could I just make a quick clarification on something Sean said earlier? He said that we would not be offering lunch at the elementary schools. We will be offering breakfast and lunch to all students attending the elementary buildings, whether they're attending a half day or a full day.
Does that work if they have to get on a bus?
We'll be offering to, like we've been doing since March in the summer, to our students at need, we will be offering. So those kids that are leaving will not be having lunch with us, but those kids that have a need for food, or those students for some reason that they're involved in a program that is bringing it beyond that, we would be providing. Is that what you meant, Michelle?
No, Ken, we have to offer it to every child, breakfast and lunch, whether they're eligible or not, based on their eligibility because of the new regulations. So we will be doing packaged lunches that kids can take home and packaged breakfasts that they can take home, depending on what time they're attending. So no child will be denied a meal, whether it's breakfast or lunch.
Right, based on the eligibility. We're not sending all of our elementary kids home. It's going to be based with a lunch every day.
If it doesn't matter if they're eligible for free or reduced, they're still eligible for lunch.
And my message, just to clarify, was that they would not be eating in the cafeteria physically, but they may, obviously they could take a lunch home or a breakfast home. They just would not be eating in a collective area together.
I'm sorry, if a student comes in the morning and we give them a breakfast, we're expecting them to eat that breakfast the next day, not in the building while they're there.
So Sarah, if a student comes into the building with a need for breakfast and we provide breakfast, they will eat that breakfast in the classroom setting. We do need to work on, exactly what that would look like as far as them in the classroom, eating their breakfast before the school day started. But we don't see that as, we don't believe that's going to be a prominent practice, just because most students, I think, will come with breakfast. If we do see it as something that's prominent, I think we'll need to address it. But right now, we do not have plans to have, a typical lunch, like we would in a normal phase 1.
Can I just, I so uncommon for me to jump in here, but Michelle mentioned something that, that I think needs some clarification. So the regulations that I think she might be referencing is the USDA put out the new regulations about food, and that's where there's not the distinct, and it came out, by the way, again, speaking of ongoing constant change is the constant, right, Mr. Bachelor? August 31st. So while the health and safety plan was created and approved earlier in the summer, and this is an adjustment, this is a change that came very late in the game. And is that accurate, Ms. Deco? This is based on that regulation that just changed at the end of August?
It is, and we're
Okay.
working on getting out notification to all of our residents about
Right.
what options are available to them.
Really, my only point, and the only reason I'm interrupting now, and Ms. Goldman, I'm going to get to you after this, is just to say that, what I'm hearing from Dan and Sean and Ken and the whole administrative team is every time something new gets thrown at them, they just keep figuring it out. And this regulation has created a change that they are going to have to adapt. And I have a lot of confidence you guys will figure out a way to do this. And it's not something that it wasn't something that we've known about for months and just didn't address. This is brand new, just, 3 weeks ago. Is that accurate, Mr. Bachelor?
Yes, that is accurate. And actually, we have information. Mr. Petiti and I had a conversation just today on how we want to make sure that we are making all our families aware that it is, open to our community, that if there is a need, for food, if there's any need, that the requirements that used to exist for free and reduced lunch has been opened up and has been opened up for our entire community if there is a need for food. And so there you will see more communication to our families and, stretching all of Radnor community in the coming days.
Okay, great. I'm sorry. Now I know, Amy, you wanted to ask some questions. Why don't you go ahead?
I have one, and it'll be brief, but for the sake of parents navigating this new scenario going forward, does the administration have any particular recommendation for questions, how parents should take their questions about different procedural things throughout the school day?
Yes, I mean, if parents have questions about procedural things, they should be reaching out to their teacher. Now that school is up and running, I always say, start with your teacher, and then they should, if there is a question that, maybe it's more structural and you don't think it's a question for your teacher, reach out to your principal or assistant principal in the building, the guidance counselor. Those are the places that parents should be reaching out to first, so that they can, get back to them quickly and make adjustments as needed.
Thank you.
And I got to tell you too, the helpline, as I just keep mentioning this from a technology standpoint, and again, depending where we are at the end of tonight, but we're still virtual this week. Our technology helpline, it's pretty prominent on our webpage. Our principals have been sharing it out. Dr. Hand has done, our technology director has done a fabulous job of staffing that, of making sure that there's quick responses, and that and with the troubleshooting. So we do have a phone number with a helpline for technology that has really been effective. And again, that was something we learned from the spring. People mentioned there's got to be a place we can call, and he's got enough people on that list and where that phone number goes that it rings and somebody's picking it up. So if there's challenges specific to technology, there's a helpline for that. If it's challenges with structure or what's going on, classroom teacher or principal, as people move forward.
Amy, do you have any more questions? Jeff, I see, but let me just see, Sarah, I don't think you've had a chance to ask any questions yet, but so let me jump to Sarah and then I can come back to you, Jeff, okay? Great, thanks. Sarah, go ahead.
I did ask the one about breakfast, but I just want to follow up. I appreciate the clarity about the lunch plans at the middle school and the high school, because I think we've had a lot of questions about that. The one thing I know periodically, at least at the high school, and I think even sometimes at the middle school, the kids are able to eat outside. At the middle school, there's a small eating area.
seating area outside the cafeteria, and at the high school, there's the courtyard. In order to really kind of control flow of people, are you closing those spaces, or will there still, weather permitting, be those outdoor opportunities for students?
So we do have the courtyard, which I consider as an extension of our cafeteria that's directly beside that. So that still is available for students. At the middle school level, we have further subdivided the groups, so that it's much smaller. So they have cohort style lunches. So sixth grade all eats lunch together, approximately 300 students. If we were all in phase one, since we'll be in phase two, we'll have approximately half of those students. So we'll have 150. And what we were doing is we were taking 75 of those students and having them do recess first. And then we're taking the other 75 and we're dividing them between 3 locations. So, and that's one of the ways that we are trying to really space out our students as we feed them lunch.
Okay, thank you.
Jeff?
I just had a quick question, and it may be coming to communication. Carpooling and parents driving. We learned from the summer, I'm sure it's even more now, many families will be driving their children to and from school. I've heard, the schools that are already open, the private and parochials, a lot of backups, a lot of traffic jams. You almost need a traffic cop. Just if somebody could share sort of some thoughts around morning and afternoon drop off and pick up. I also noticed, it's like, I don't know if anyone else noticed, the light at King of Prussia Road. Yeah, everyone's smiling, like 1 car per light. That'll be real fun. That's not Radnor Schools, that's PennDOT, I'm sure. Sounds like you're on it. Just maybe someone could speak to just that, because I'm sure that's going to be a big part of our opening week if we vote tonight for hybrid moving forward.
I'll jump in first I'll let Sean and Dan talk about the buildings and arrival and departures. But before that, yes, we are aware of the concern with the light, and we did have our people looking into that. So we'll get an update as soon as we can and find out the status. But yeah, that came to our attention, I think, recently within the last week or two, the challenges with that turning lane.
Great. Andrew or Lydia, do you have questions? Lydia, go ahead.
Yeah, this just really quickly, this is for Mr. Batchelor. So as, events progress and say there's a COVID infection in 2nd grade or a bus, how are you going to communicate that information to the board? Are we?
Same way he communicates it to the public, whether or not he's allowed to.
No, I don't mean, I know we can't, I don't want to violate anybody's FERPA, but more, are you going to give us weekly updates,
Yeah, so
how many infections in the district, or, just what is your anticipation of how you're going to do that?
my anticipation would be through our normal structure. So, every Friday I give the board an update, especially those Fridays that are prior to a board meeting or committee meetings. So those Fridays I'll, would give an update on, situations like that. Again, we will work very closely with the Chester County Health Department. We will be sharing information in consultation with the Chester County Health Department with those people that we need to share when there is a situation, but certainly as a school board, the broad-based summaries and keeping you abreast of what's going on will continue to do, as we do right now with many matters.
Great. Andrew, do you have any questions?
Yeah, sure. So, I think that this is all really positive in general tonight. And I think the reason for that, as Ken, you said.
Wait, Andrew, do you have questions or comments?
I have questions. Just let me ask the questions. Thank you. So, I think we're seeing some positive trends, and that's good. So I think it is quite positive. However, I just have a couple questions about readiness. You were talking about the Chester County Health Department and 3 reasons why they might recommend staggering. And one of them was readiness. And I just like to hear your thoughts on, maybe you could just elaborate on that. Maybe tell us in the community how our teachers and staff have prepared.
Yes. So, not only have, again, as I talked about, our administration, has been, working diligently on developing our protocols, working closely all summer with our operations and our custodial and our support staff to make sure structural things and procedures were in place when our teachers returned. But then our principals have been working closely with our teachers on what are the procedures for them, first off, to how do we in a working environment coexist. It is absolutely critical of us wearing the mask and absolutely critical as adults that we don't let our guard down, that when we're doing lunch, we do lunch very carefully. And that, I was even having a conversation with two teachers today, the challenge of really, you got to eat by yourself. And then if you want to be social for a half hour with your colleagues, go into the library and each sit at a table with a mask, but not do it during lunch. Because during lunch is when we as adults are going to spread it amongst each other if there is a situation. So we've got to really be vigilant with that. And so the opportunity for our teachers to really practice and get those protocols down for what they need, and then to get those protocols down for what then our students need as well, from movement in the hallways to use of bathrooms to cafeteria and all of those pieces. What has also changed for us to be ready is bringing special ed in. We had to be ready with all of our arrival and pickup and movement for those students and having students in our buildings already. And when we had students in this summer, and we've had some of the students in now, it's also realized for, especially at all levels, the challenge of, some kids are here, gosh, we'd like to have them all here, and once you have some here, the protocols don't change because we add more students. We had to have them all in place just to have some students. So we're ready from that standpoint, that, having that experience with some of our students, that we're ready now to have more students, and actually things will be a little more seamless, especially as I look at the elementary level, the challenge of having some students in and some students not, because we're really designed at the elementary level for an AM with the class and a PM with the class. Whereas we're more comfortable with the remote, with some there and some, and I say more comfortable, it's the plan. We're getting more comfortable with it and we're working on it, but that's the model at the middle school and high school. So yes, there's been just a great deal of work and a great deal of adjustment, a great deal of feedback, and what do we need to move? What do we need to change? Simple things like, dots, and actually board members, I probably neglected this, and Andrew, I'm glad you asked this question. In the next week, let's set up, I know some of you took the opportunity to, early on to take a tour and see our voluntary practices for athletics, and thank you. It was so great for you to see the program, to see what was happening. Let's set up in the next, next week and the week after, and maybe, small groups, opportunities for you to see what our buildings look like, for you to see, we're not allowing any visitors into our buildings right now. But certainly as board members, in small groups, I think we can talk about and look at what would make sense for you to try to just observe and see. And I could talk to you about that in the coming weeks, how we could possibly do that as a school board.
Okay, thank you. I do have a couple follow-ups. So, one of the reasons why I asked that question is because I think there's an unexamined assumption here, maybe, that one kind of readiness might, automatically lead to another kind of readiness. In other words, teachers in the buildings have been doing certain activities, but does that signal to you that that a staggering approach wouldn't be, let's say, useful at this time? Look, I understand that we're kind of in a race against time. I've called it a moving target. We have a window of opportunity here, and I agree that we should be taking advantage of it. But I just, the staggering options that were presented to us last month seemed pretty compelling. Dr. Brennan talked about a runway. And so, I guess, getting rid of the staggering approach, I know it buys us time, but, maybe you could just wrap up with a couple additional thoughts on the readiness and the staggering issue, maybe.
Yeah, so a lot of it's coming from our experience. Summer math, summer ESY we looked at from what we needed to do the first day when we brought those students in the summer, and then how we had to adjust. You know, and Mrs. Lesage, Jenny shared a great story from the summer program, how, you know, the first, you know, as much as we were prepared and we were as prepared as we could be, and yet the first time those kids came in the summer, as soon as the afternoon came, as soon as the next day came, we made some adjustments, because as soon as the kids were there, we realized, oh, okay, doing that arrival departure this way made sense on paper, made sense as we planned it, but now that we saw where the kids actually went, we made adjustments. And we realized that in that summer program, it really took us just a day or two to see what was happening and to adjust. And then now the opportunity to have some students back right now, again, we're seeing that same thing, that first day is a bit of a, you know, okay, we're in it. The change is there. What do we have to? We're having immediately looking at what we need to adjust and change, and then the feedback we're hearing from some of our teachers that, you know, why do we have to? What's the benefit of the week? What's the benefit of the 2 weeks? And really, back in August, when we talked about the benefit of the week and 2 weeks, it had a lot to do with following positivity in the county. A lot of that staggered approach was about, you know, we'll give it 2 weeks and let's see what the positivity is, and then hopefully you can get other kids back. That kind of mindset has really shifted, I would say, with the idea that we're at a point now where there is a window. And the window is because we are stabilized. So if you are ready and the pieces are in place, that would be the time to take advantage of this window right now. So that's part of what has shifted, I think, also, you know, with that staggering approach. And, you know, and both the doctors who we brought to our meeting, who have just been so helpful, have also talked about, you know, the tolerance. You know, what is a community's and all of our, you know, tolerance as well. And they came from that from a very genuine standpoint that, you know, we're looking to get our kids back at school, and every week we're going to be at a different place. And we're at a very different place now than we were in August. And I think that's why we're comfortable adjusting that staggering now from what we discussed in August.
Okay, thanks. One final question, I promise. So the Labor Day spike or lack thereof, you know, that could not maybe materialize for another 5 to 10 days. So that's another kind of risk area that I just wanted to highlight and get your thoughts on that. What do you think?
Yeah, no, I think that if we didn't have, you know, it's only because it's sitting here, we didn't have the doctors saying what they're saying about, you know, the time may be right now, based on what they're seeing in the trends. That next 2 weeks would have me more concerned. But because of what we're hearing now and what they're seeing with the stabilization of that it's more stable, what we're seeing, but we could likely see in the next 2 weeks, you know, that the more of an impact from Labor Day. But again, what we're hearing is that it hasn't materialized. It hasn't materialized in the first 2 weeks as anticipated. So now there's, you know, we're hedging our bets in a sense that hopefully the next 2 weeks won't materialize in the same way that it didn't materialize in the first 2 weeks. Does that make sense?
Yeah, no, that's good. And I think, you know, your answers to both questions, I think helps us understand, guys, everyone that's listening here, that, you know, this is a matter of managing risk. There's no surefire safe decision or surefire dangerous decision. It's about layering different probabilities and risks, and looking at the data and weighing that. So thanks.
Lydia, I think you said you had one more question.
And I'm sorry if I totally missed something, but is everyone already assigned to their group A, group B, or A and PM group?
Yes.
Okay. And is there an opportunity, I don't know, if something happens that you could petition to switch your group? I'm just curious. If
So
that's
at the secondary level, not at this time. So we went and counted out all of the classrooms, the total number of seats, and how many students are assigned to each class. And so, you know, that's something that we could circle back to after we get this up and running. So if the administrators, if everything goes swimmingly, that's something that we could re-examine. But at this point, there's not an opportunity at the middle school or high school based on all the work that was done to bring the kids in to make sure that they can fit.
No, that's fine. I'm not suggesting there should be. I just wondered if people were lobbying for that. Thank you. That's all I had.
Great. Yeah, go ahead.
I just had two quick questions for Mr. Dukevich before we get into comments or your questions for that matter. For Right at School, is there still the possibility that when the students are in the cafeteria or the gym, wherever it is, that they can be encouraged or even directed to socialize or be near the groups that are their elementary classes? So if you have Ms. Viola Swamp in the morning, and then in the afternoon, could that be your, the group you're spending time with within the Right at School setting, or is that just, kind of logistically too hard? But, I really like, again, the cohort model at elementary. How much can we preserve that for those families that elect the before and after care?
A great question, Bradley. I think, Right at School has a new regional director. We have a new local director. So far, I've heard very positive things out of Ethan. I have it on my list of things to do. In fact, to go visit the program. I have not been able to get down there yet, but I plan to do that and see it in person. They very intentionally have tried to group to make it, again, to keep that mitigation of, mixing kids too much. Right now, it's been like a full day program for a lot of kids, but going into a half day program, I think that's going to be even more important. So it's a question I have as well. I want to make sure that they're, as they're planning to go to AM PM, I have talked to the regional director, Andrew Cohen, who has offered many times to come on to our board meeting, by the way, and answer questions. But, he's a regional director for many different districts across the East Coast, and they're asking very similar things. And they're working to implement very similar things across the board. So I will take the question back. My answer right now is that, yes, I think they would be intentionally designing cohorts to mitigate any kind of interference with other groups. At the same time, they are in a large space, and it is one space, but I think they'll try to cohort that together as much as possible.
And then the other question about elementary, in the hybrid model, what is the latest thinking on what happens if there's a child who's in the hybrid at elementary, but they get sick, they get exposed, they have to quarantine? Right now, my 6-year-old second grader knows how to upload her assignments on Seesaw. I don't know how to do that. And it's because her teacher taught her how to do that and taught her well and effectively. And so, that is an example of how the synchronous aspect of remote learning has looked. How much do students lose that if they're stuck at home because of, what the health situation requires?
Excellent question, Bradley. This has actually been something we've been talking about quite a bit lately. And we've actually elicited some guidance from Ed D'Orazio, our solicitor, and to get some language and also to look what other districts might look to do. So in a situation where a student would have to quarantine, really we have three options. They would, in a traditional sense, have asynchronous work, things that they missed during the day sent home. Usually the parents are doing that with them and independently. If it's a long-term thing in the past, again, maybe we would look for like a, instruction in the home type of situation. Another option would be for them to join the cyber program. Of course, that would mean a new teacher, a different class, potentially a different pace of where they are in the curriculum at the time. And the third option is kind of borrowing a layer of the secondary model and having, if it's just a small population, and for a portion of the AM or PM, to zoom into the class on an iPad, on a tripod, and join a reading group, a math group. So their instruction is live with that teacher that they're used to with their classmates. And again, all these things are predicated. If the student is quarantined, are they ill? Are they able to participate? If they are, then we have to make a decision on how we deliver their instruction. If they're not able to participate or able to participate at a very minimal level, then maybe one of the other three options is the right option for them. So right now, we're just kind of taking it like each situation at a time. One situation may result in one of those, another may result in another. If a quarantine is going to be much longer than 10 days for any number of reasons, maybe moving to the cyber program is the right idea. We also know that with using our bandwidth and using our Wi-Fi, we don't want to tax the system for secondary. So, we're going to be very cautious and trial and error things as we go. And I think it's just going to be based off each situation.
Thanks, that's very helpful. appreciate Mrs. Stern letting me get those 2 questions in as well.
And let me tell you, the hiring of Mrs. Viola Swamp was quite a power play we made this summer.
That must be a joke.
It's an old children's book.
Children's book.
Oh, got it. Okay.
Mr.
So
Stern, oh, I thought you would.
you have to tell me the name of the book. Yeah, I'm Sesame Street these days. Remember, folks, and Dr. Seuss. Okay, so I really only have a couple of questions, and they have to just do with how the kids have been in the buildings thus far. How are the protocols going in terms of the kids moving through the buildings? You know, and how's it going so far with the students we have in the buildings so far? Just kind of generally.
Dan, Sean, I'll let you two field that.
I almost feel like I should reach out to Jenny because Jenny's been at Wayne for the last few days and done a tremendous job in supporting our low incidence classroom. I've been there the first day, and from everything I've seen, and Jenny and the team has done a tremendous job. It's not been without some hiccups, but I don't know if Jenny wants to share her perspective.
I'm sorry, and I don't even limit it to the students in the building, but we've, you know, how we've had teachers in the buildings, and you know they're moving around in the buildings, and you know I'm assuming mostly they go to their classrooms. I think I said students, but I really meant since school started. You know, we've had teachers in the buildings. You know, how's it working so far in real time? Because this is the first meeting we've had since the school year began. So I'm just curious in general how things have been operating in the buildings.
I'll jump in just to say in general, and others can jump in, and Jenny as well. I mean, I think it has been operating well. From my conversation with teachers is that, you know, there was a ton of hesitation. There was a ton of trepidation. And then once we, you know, were in and started to see the routines and started to understand how to do things, I think we developed more comfort. I think that we've also had the reality of that we've been experiencing since March and really since May. In May, we started to bring our operations. We brought our support staff. We brought people back in. And we right away had situations where staff members had an exposure with a family member, had an exposure, or they themselves. So we're living through that as well as we have our staff back. That the exposures that are happening, that is happening, you know, across our state, we're reacting to that as well. It hasn't been large, but it has certainly happened for us, and we're having a chance to then, you know, respond with our protocols, respond if, you know, if we have a, you know, if we should have a staff member whose, you know, son or daughter tests positive, what does that mean? What type of quarantine do they have to do? Who do we have to notify? We've been experiencing that and reacting to that, as I said, since May, and that has continued. So, but I would say overall, I think being back, the resounding thing I'm hearing from you know, especially, you know, some of the teachers I was talking to today I just happened to be in the elementary buildings today was, you know, they're just eager and excited to see the kids. They really want to see the kids back. Jenny, I didn't mean to cut you off. So Jenny, I'll let you jump in as well. So sorry.
Yeah, so I've been there for, I think today was my 7th day being at Wayne. And I just must say, the kids do a phenomenal job. The buildings were completely ready. There's markings on the floor. The children understand it completely, what it is they're supposed to do. All of the teachers that we see in the hall that see the kids that we're working with are really excited to see them. So it's been really positive. And, you know, the most important thing, you know, as far as is, you know, I really look at the kids are super excited to be back, and they're doing a really good job. And these are some students that have some pretty significant needs. And it's been a great 7 days over at, I've been at Wayne Elementary with the classroom, and it really has been a lot of fun, a lot of learnings going on. And, you know, the kids really, again, are excited and happy, keeping their masks on, doing a great job on the bus, getting off the bus, walking through the halls, just everything. So it's been really encouraging. And like I said, the teachers are excited to see them.
Great. Well, that actually leads into my second question. Again, overarching, not necessarily about the students who you would cover, Jenny, but Ken, how are the buses? I know our buses are running for private and parochial schools and for our students who are coming into the buildings. How are the bus protocols? How's it going with the buses? And are you expecting a large turnout from families? Are you anticipating a large use for the families with buses, at whatever point we open?
Yeah, so I'll let Sean and Dan and Michelle also from a transportation perspective can jump in there on anything, about transportation.
I'm happy to start in elementary. I mean, we've talked to John Hearn, our director, and they're ready, and the elementaries have shared their A and PM placements. So the thing I'd remind folks is, by and large, we're dealing with half of our population at one time. So it's far easier to separate kids and to, support social distancing that way. John tells us that transportation is raring to go, and, barring our next decision here, communication will go out to families about time and logistics for bus stops. But we have a video online on what it looks like, cleaning protocols, seating, all those kind of things. As far as numbers go, it's hard to say. I mean, our survey way back in the spring, I think we said 70% of parents said they would drive. That's probably changed. So time will tell. From what I understand from John Hearn, that they're prepared for all kids, and just depends on who will come and who will be driven to school.
Okay, great. And Ken, the next two questions I'm going to ask, I know the answers to, but I'm throwing you a softball because I think it's important just to get the information out there. I have watched the webinars from CHOP Policy Lab from Drs. Rubin and Coffin. I watched last Thursday's that was directed toward staff, and I watched yesterday's that I think was largely directed toward parents through Delaware County. And I think I heard this last Thursday. I didn't hear it yesterday. But I did hear last Thursday, if you could just comment on this, on the general belief of the physicians, who we've been largely consulting with, Chester County about, that the request for in-person temperature checks on every child as they walk through the building, that's not seen as an effective measure to have at the building. And that really 6 feet distancing, because I know that between comments we've had and, comments that have been out in the community, and even some things that were discussed tonight, how critical the 6 feet social distancing is for our schools to be open in a sustainable manner.
So, yeah, and it's funny, the softball questions get me more nervous, but that's okay. No, from the conversations, there is concerns about, the temperature checks, as we talked about, the medical, they're just not as a reliable indicator, especially as we're talking about kids. I think it's over 50% won't ever even show a temperature, and they may have COVID. So it's just not a reliable indicator. And the concerns of what we may create with backups at our building in trying to do that, the medical community actually has greater concerns about that what we would do. And then the other piece that you talked about was, and we can't emphasize this enough, wearing a mask, being 6 feet is critical. I think if I quote him right, I think Dr. Rubin said, that's 90% of it. He talked about, stories of the situation with a hairdresser who, was COVID positive, cutting hair. And they contact traced all the people that, all the clients, and it was over 100 that came in for their hair from this person who was COVID positive, and never spread. It never spread because the person was wearing a mask, even though they were within the 6 feet, but they were wearing a mask, cutting their hair. I went to my dentist. I hadn't been to my dentist, and I went to my dentist appointment and, rescheduled and went in August. We've known our dentist for a while. He does all our kids. And right away I looked at him, I go, how are you doing? He looked at me and goes, Ken, how are you doing? Knowing what I do. And in that conversation though, I said, how hard was it for you to open? And he says, well, it really wasn't, because we looked at the science and the dentists are wearing masks. He talked to me about all that they went through, and that, even pre-March, because they were wearing masks and they wear gloves, that they weren't, they were protected, and that they were able to keep their offices open and still see patients. But the importance of the mask, the importance of the rubber gloves as they're seeing patients. And we've had a lot of our doctors in our community talked about, how they're working in, situations in hospitals where they're seeing COVID patients wearing a mask. So it is critically important that we trust our protocols, and that we stick to our protocols, and we make sure the masks are staying on, and we make sure that we are keeping the 6-foot distance, as we go through now our day and have our kids in. And that, yes, the challenge of the 6-foot distance is going to be that challenge that we're going to have continued discussions going down the road. Because obviously there are stories where clearly there wasn't spread and people were wearing masks and they were with, less than 6 feet. But that's going to be a conversation, as we talked about earlier, for down the road. We got to right now make sure, as Dr. Rubin said, is the distancing, the masking, that is a huge piece of it. And I'll also throw in there the hygiene and the screening. Make sure we're washing our hands, that we got to make sure we're washing our hands often. That's part of the protocols that we want to train our kids, show them when there's opportunities. It's different for a second grader than what we're going to be showing our seniors, and the screening, and making sure that we're being smart about it.
Okay, great. Well, we've had a lot of conversation, so I'd like to just move into the priority action item. Item 5.1 is that we approve the timeline for elementary students. And the recommended action is that the board approves the below timeline for moving elementary students from phase 3 virtual learning to phase 2 hybrid learning for those students that chose the hybrid program. This timeline may change or be altered at any time by district administration. And at this time, I will entertain a motion and a second. I have a motion from Amy and a second from Liz. So I'll open it up to board comment. I don't know if there is much comment to be made. Amy, do you want to start?
Yes, I want to say to Ken, thank you again for your clarification about what's gone on this summer. We've had, by my count as a board, at least 30 meetings in the past 3 months. So it can get confusing as to what exactly we're doing in these meetings, and 45 hours and counting, and that doesn't include the 5 hours that many of us have been in meetings for the board starting at 4:30 this afternoon. So it's understandable that things can get confusing. I really appreciate your clarification that this board has followed your tremendous guidance. You are our chief executive officer of this district, and you are responsible for managing every aspect of our operation. You've got an extraordinary administrative team. You've got an incredibly dedicated faculty. You've got tremendously caring and dedicated support staff. And there are many families out there who have been very patient and followed along as we navigate a completely unprecedented experience in all of our lifetimes. And on July 28th, you asked us to approve a hybrid model, and we did. And then on August 18th, you asked us to pause, start off virtually, and come back tonight to hear what you wanted us to do from this point on. So I just want to say thank you for clarifying that. There's been some, confusion out there, and I think it's understandable given how much conversation we've had. But I appreciate your clarification, and I'm going to support this motion because I am eager to see children return to their teachers and have teachers be able to embrace their children. I think it might be, sometimes children have a hard time getting back to school. I don't think that's going to be the case for a lot of children this year. They're going to run from their parents and leave them in the dust probably. So it's exciting. I almost wish if you're going to take us to those schools, we could be, viewing it maybe from above, watching that first day, hopefully, if this is what's going to happen. And so again, I want to thank everybody in the community for your incredible support and patience, and urge respect for one another, as so many people have so many different needs that had to be accommodated, and sometimes those needs can be in tension with one another. So I'm glad we're at a point where we can make this motion, and I look forward to supporting it. Thanks for giving me the chance to say that.
Okay, is there any other board comment? Oh,
Mrs.
yes, Bradley.
Chairman, I have comment, but it's largely about the second motion. Would you rather entertain all comment now and then have the votes, or wait?
No, that's fine. If you don't have comment on this one, that's fine. If there is anybody else? Alrighty, well, I have just a short comment. I too will be supporting this motion. I was asked to review the minutes of our August 18th meeting by a member of the administration. So in order to confirm how August went, I ended up watching kind of the last portion of the meeting. And I got reminded in watching the last hour and a half of the meeting, this is not a board that wanted to go virtual. I listened to the comments again. I watched the motions. This is a board that followed Ken's recommendation to begin the year virtually. And then we were subsequently unable to come to consensus on how to reopen, how to bring kids back in. And I even at one point in the deliberation, when I finally brought forth the motion I made very late in the night, I said, we're clearly not ready to decide how or when to bring the kids back into the building. It was never a question of if. For the majority of us, I know that probably would not have been a unanimous vote that night. And I stand by that. We weren't ready that night. And in fact, by going with the motion that ultimately passed, here we are on September 22nd, set to consider a motion to bring our children in on a much faster time frame than we initially considered last month. And one of the things that I really appreciate about this recommendation, Ken, is our plan in July was to bring everybody in on the first day. And what I've heard you share tonight, what I've heard Dan share and Sean share, and even Jenny when she was talking about the kids, is that you've learned something having the teachers in the building. And then by bringing some children in, and then by bringing in some more children this week, and that your approach next week in this motion, the intention is, let's bring our kids in a thoughtful manner that has it be successful. And I actually think to myself now, looking back, it really might have been a very challenging start to the school year, bringing all the kids in on that, all the hybrid kids, all the entire cohort in on that first day. And that's not to say that virtual hasn't been very challenging for families. And, but upon reflection, of a quick phase in, taking the time to give the kids an opportunity to be shown the fire drills and shown the protocols, is maybe going to have us be the most successful we can be for the long term. So, all right, if there's no other comment, I will call the vote. All those in favor, say aye, or raise your hand. It's easier for me. And all those opposed, wait a second, I don't see Bradley on the screen. Oh, there you are. I'm sorry. All those in favor, if you could do that again. So sorry. All right, 1, 2, 3, 4, 5, 6, 7, 8. The motion passes 9-0. Great, super, everybody. Thank you. And now we'll move right into our second item, which is 5.2. This is a motion to approve the timeline for secondary students. And the recommended action is that the board approves the below timeline for moving secondary students from phase 3 virtual learning to phase 2 hybrid learning for those students that chose the hybrid program. And this timeline may change or be altered at any time by district administration. I didn't go through the steps of reading all of that. It's rather convoluted and intentional. So at this time, I will entertain a motion and a second. Motion from Jeff and a second from Sarah. All righty, I will open it up to board comment. Mr. Moore, you mentioned you wanted to make some comment.
Sure, thank you. I'll go first. I did mention that. Mr. Batchelor, I thank you for all of your leadership and the decisions you've made that have gotten us to this point. Bringing in ESY and the summer math pilot, having our teachers teach from their classrooms on day 1 of the first day of school, bringing in special education students as the public health guidance allowed us to do. Every single one of those decisions, I think, as Mrs. Stern said, has put us in a better position to implement the hybrid plan than any other school district in this area. And, you know, this probably won't catch on, but I think we're rather ready for our protocols. And we have heard parents loud and clear who have said, you know, give us a choice. But we've never wanted to take a choice away. But, you know, it's a fact that most issues that this board has to decide are not decided by referendum or petition campaigns. We have to make judgment calls based on all the information in front of us. And we have to take the long-term view. We're stewards of this district. And in my mind, the long-term view requires us at this stage to recognize that there is a moment that allows for reopening to happen for all of our students, but also to consider that we want that reopening to be as sustainable as possible. And that's something that I believe I've said consistently throughout all of our deliberations on this. It's not just about getting the kids back, but it's getting them back and keeping them back in. And, you know, all of us have said our reasons for we vote. I don't think we have secret or dark or hidden reasons. I think we've all been actually quite transparent about our motivations for this. So we're in a situation where we have state guidance and county guidance. In that guidance, we have a band that says we can be virtual or hybrid. So even though the guidance allows us to be hybrid, we still have to make a judgment call about whether at any given stage virtual or hybrid is the right call. And you've given us lots of reasons why hybrid is the right call for all students at this time. But there is also, because there's that choice, there are gaps in the guidance. We can look to other sources that are also expert in scientific sources, like the physicians that you listen to when you're in meetings with the county and the other superintendents. You know, things like, it's just one example, not the only guiding principle, but things like the CHOP Policy Lab guidance can fill in gaps when the other guidance we have doesn't speak to that. And one of the things in that CHOP Policy Lab guidance is this idea about staggering students into the building. So, you know, from my point of view, that carries a lot of weight with me. I've always been committed to the science for this. I voted against the hybrid plan on July 28th because we didn't have metrics. And just from what I had read, you know, reading other people's research, where the numbers were at the end of July, much higher than now, we're not at a level where if you open, maybe it works for a while, but then you have to close again. So sustainability is very important to me. I didn't think we necessarily needed to reopen the vote after July 28th. I was happy to be outvoted. I wasn't happy to be outvoted, but I had the chance to say my piece and I was happy to move on. I think it's actually dangerous to reopen recent board votes in the next few months or maybe even years. That's a dangerous thing to do. It was only because you called the meetings for us in August and made a different recommendation that was even before the board from my point of view. You know, don't be surprised that I'm changing my vote now, as I just did on the elementary model from where I was in July, because the science has changed and I was always committed to following the science. The research that's out there, the tentative research still has not, this research is ongoing, it's a tentative finding, but it still says that older kids are higher risk than younger kids when it comes to spreading the disease. It's less of a concern about them having severe outcomes themselves, but a lot of the research suggests that the older kids spread the disease as efficiently as adults do. And that's so unfair. That's so unfair to them. It's not their fault. It's you know, the biological mechanism for that hasn't been figured out yet, but it's hardly fair to kids that's the situation. But it is the situation. So in my mind, I think we should have a higher bar or at least more caution when it comes to shifting to phases with more in-person contact at the secondary level versus the elementary level. And again, it's about sustainability. It's about wanting those kids to get in the buildings, but also be able to stay in the buildings because the risk of outbreaks is higher for that age group. And that has an impact both in the school building, but also in our community, affecting all of us. So I don't follow these guidances that say you should consider staggering. I don't follow it blindly. I've had people email me saying like, oh, you went to Penn, you used to be on the CHOP IRB, you're just, you're too connected, you're biased. If anything, these connections give me more cause for skepticism than anything else. So I don't follow any of this blindly. And in fact, I'm very thankful to some members of the community who gave us more information. I had a phone conversation with somebody who was, in the aforementioned, Reopen Radnor group, who pointed to me to some other resources like the Mass General Guide on reopening. It was very helpful, and that document was, I think, especially good. And one reason I think that community member shared that with me because it talks a lot about mental health in teens and adolescents, and that was an important piece of information to consider in conjunction with all of this other scientific research that has been emphasized. So with all that in mind and some of the differences we know about what happens with these older kids, I was surprised and a little concerned to see that the plan for reopening at the secondary level was this quick. And I'm not sandbagging Mr. Batchelor here. I kind of gave him my thoughts on things a week ago before he even made his recommendation in a phone call. So this is all information he's well aware of. So I was concerned about that. And I don't have any desire to delay things for the older kids. It's not their fault, as I said. I've heard the comments from parents and from the kids themselves. I see you, I hear you. I know this is hard. I value our secondary program. Before I was a lawyer, I was a high school teacher. I was a high school teacher in Philly. I've seen how serious trauma and stress can have for that age group. And it's an age group that is vulnerable in ways just like our younger students. And I have confidence in our protocols. That was actually never an issue for me. When I was, Mr. Batchelor mentioned that some of us visited the high school workouts. When I was there, PT Kevgas was around, and Ms. Kevgas invited me in to, kind of see what the classrooms looked like and all the work that they had done to get us ready. So I do feel like we're ready. And I don't doubt for a second, Mr. Batchelor, everything you said about us being ready to implement our protocols. But the idea about staggering was about two things. One thing it was about was make sure you're ready with your protocols. And the other thing was about, because this is a higher risk group, you should consider bringing them in later because it affects your community spread. And it's that last piece that I'm still concerned about. So you might even remember on August 18th, I had said in a comment, I probably would have voted for 2C if it weren't for the concern, for the guidance saying go to October 12th because of the Labor Day issue. Now that the Labor Day issue is receding for us, 2C sounds right to me. And I think it still sounds right to me with the old 2C. So, I appreciate that, from the sense I get from everyone else's comments is that the secondary plan is likely to pass, regardless of these concerns I'm articulating. But you've asked for our vote on this. And so it's my job to say what my concerns are. And even if I vote against the pace of the secondary plan, the reason for that is because I think it would be more sustainable for us to wait, to space it out more like 2C. We'd be less likely to have a problem because of that. The secondary plan has everything the elementary plan has, except for that additional health risk about spreading the disease and the small cohorts. The secondary level has more mixing than the elementary level. So because of that difference, I'd want to implement the elementary plan, see how it works, get that week or two of data. I stand by that as what I think the right thing to do is. The guidance that is on paper has been reaffirmed. We all watch the same webinars. In those webinars, those physicians still say, we stand by this guidance. It's still the right guidance. The staggering is part of it. The administration selected a more aggressive plan than that staggering would have called for. And in my judgment, following the science, a more measured pace would be appropriate. So if I'm outvoted again, I'm comfortable with that. And whatever the outcome is, Mr. Batchelor, even though I just disagree with you on this particular point, you always have and still will have my support. And my wish is for this to be as successful as possible.
Thank you. Do we have other comment? Andrew?
Sure. So, Mr. Moore, you saved me a little time. I think we're on the same page about a lot of what you said. Ken, I already brought up the earlier issues about staggering and some of my concerns. I think Brad echoed those concerns pretty well. 2B last time was probably the most aggressive or at least assertive plan. And this is even quicker. And so, it does give me pause about readiness. Does give me pause also about Labor Day effects not really being here yet. And then some of the other dynamics that Mr. Moore already mentioned. So, changing classrooms, et cetera. But, on the curriculum committee, I've had a chance to talk with Mr. Bechtold and Mr. Dukevich fairly extensively about their thinking and their plans. And everyone needs to know that we have good plans. And I've actually, I've had my criticisms of the health and safety plan. I have. But overall, I've been saying that I think that it's a good health and safety plan overall, despite some things here and there. So what my refrain over and over again has been that the numbers will dictate what we do. So for example, in Germany right now, they're seeing a little bit of a spike, but they're not that concerned. Why? Because the overall transmission situation isn't that bad. It's not nearly as bad as it is here in the United States overall. All right. So I just want to mention a couple of things and then I'll wrap up. So on July 21st, I, just made some jottings on the back of an envelope with publicly available information that, just some metrics, because we weren't really being given any metrics. To Ken's point, Ken has been saying, it'd be great if we had some numbers. It'd be great if we had some guidelines or even some bright lines. So that was an attempt on my part to kind of get that conversation going. So what I said was, people are saying we need to see at least 2 weeks of declining case rate, percent positivity rate, different metrics. And I said, let's double that just to be on the safe side. And I was just kind of looking around at countries where things have been sustainable. And it looked like they had, a weekly total amount of new cases at around the 200s. Well, guess what? Our 7-day case total right now in Delaware County, new cases is 260. It's pretty good, right? And we are at 46 new cases per 100,000 in Delaware County now. We were 75 back in August, around our August 18th meeting, okay? So in Delaware County, we're looking a lot better. However, in Radnor, we're actually higher than we were. We're 56, and then we were in August 18th, we were 40, right? So, I'm seeing a trend, and Dr. Rubens talked about it. Ken, you and I talked about it on the phone the other day. I'm seeing a trend of, the past 4 weeks, we're seeing either kind of going really noticeably down or kind of hovering around the same area. And some metrics are really good. And so I guess for me, the question is it worth the risk? And I think now we do have a window of opportunity. And I'm sticking to the metrics that I put forward for myself anyway, back in July, right? And I've said over and over again, like Brad said, I'm going to follow the science. I have no other reason to decide anything but the science. With all due respect to Laura Marion, please feel free to do what you want to do. With all due respect to any other local municipality and what you decide to do, go ahead. Personally, that is not my concern. You know, people need to work. Kids are having some hard times adjusting. That's all understandable. I understand that. I really relate to that as a father of an 8-year-old and a 5-year-old. But as understandable as those human reasons are to want to get back to school, you know, you want people back in the building. I understand that. But the bottom line is the epidemiological reality. And so going forward, I was really encouraged to hear Ken talk about, and his team talk about, that we're going to be monitoring the numbers and we're going to prioritize safety and we're going to follow those numbers. And that is going to be the #1 criterion, what the epidemiological situation is. I was very heartened to hear that. So I think, again, this is a positive night. On the other hand, you know, with the high school situation, I would prefer to see a staggering situation along the lines of what Mr. Moore said earlier. Thanks.
Jeff.
Thank you. I am in full support of the administration's recommendation for this and this motion. I thought you were kind enough to let me be the one to offer the motion. I think it's past time, frankly. You know, I appreciate and respect what our experts put forth in the concerns about Labor Day being the real reason, or one of the main reasons, to hold off starting school in a hybrid fashion across the region. So far, knock on wood, looks like we've come through. Yes, we'll see the numbers, but we don't live in a hypothetical world. We live in the real world. And the real world is that people, our community, 80% plus, desperately, that's not even a strong enough word, want to be back. That their mental, social, emotional well-being, not only of the children, but of our working parents, our caregivers, that have spoken loud and clear, and that have helped us. Our community has helped us, not in and of itself alone, but have helped us, you know, learn and come to where we are tonight. So appreciate the administration, our teachers, for being in school, and thank you for what you've done this summer, for what you're doing now, to be ready. It won't be perfect. We know that there will be adjustments along the way, but I think where I bottom out on this is the window. You said it before, Mr. Batchelor, is we have a window. You showed the article with the headline in the Inquirer from the weekend. We cannot waste this opportunity. I am opposed to a slower, staggered approach that would just risk, in my opinion, reopening it all. If we wait until mid to late October or early November, as in some of those plan options were back in August 18th when we saw them, we are risking not even giving our high school and middle schoolers a chance to be in school. We can't do that. We can do this. Mr. Moore, I loved your new hashtag, Radnor Ready. Even if we have different thoughts on approaches, I think we are Radnor ready, hoping and trusting and believing in the best, and also pleased that the administration will have the wherewithal, as we, in our role as a board, to help, but you to make those operational decisions as you see the numbers with us as well, and to see it on the ground, to see how it's working. All due respect to epidemiology, to numbers, I also want to see what it does to our humans, to our kids, to our parents, mental health, social health, in addition to physical health. So I'm proud to support this, and I'm looking forward, hopefully, to a successful beginning of the hybrid phase 2 option. Thank you.
Okay, is there any more board comment? Nancy, go ahead.
I completely concur with the remarks that Jeff made. I have been all along pretty much a strong advocate for getting our kids back into school. I think not only the elementary, the last vote that we just made, which I think it's critical to get them back for their early learning, I think secondary is just as important. Given what they've been going through, they're older, they're wiser. They've been out of school since March. The isolation, anxiety, and depression that they've been experiencing, the consequences, I don't even feel that we've realized it yet. They've had a lot of losses so far in the last few months, and we really need to get them back into school. And I think that as we saw even at the beginning of the year, where we have this window of opportunity, I think this is it. And to Jeff's point, if we don't get them back now, we're going to lose that. And, we talked about, I know the issues have been raised as far as a staggered approach, but I see this as a staggered approach. These are separate buildings. We're talking about 3 elementary schools, a middle school and a high school. And, not only do we have, what I feel is, some of the best administrators in the area, we have the best teachers, the best staff. And I truly believe that they would not be recommending this if they didn't think that they could accomplish it. And, I think it's something that our community needs and wants. And, I, as a parent, want it as well. So I fully support this. I think it's time to get our kids back.
Okay, is there any other comment? Amy, sure.
I'm going to support this motion too. I am confident, like has been mentioned before, in this recommendation. I do just want to say one thing though. And it probably goes without saying, but I'm going to say it anyway. We've seen tons of planning that's been done with previous initiatives by this administration. I remember up close and personally how hard Mr. Bechtold and so many of other administrators worked to create a scenario where we could delay our school start times. And the planning that went into that was, I don't think many people who weren't intimately involved with it can appreciate just how much went into reimagining just simply a start to the school day. And yet when school started, inevitably, like any initiative, there were some glitches. There were things that weren't exactly going to go right. Not everybody agreed that we should be doing it. And I sort of see this reopening of school in the same way. So, my plea to the community is just to please be kind to one another. Everybody on this board, everybody in the community, our staff, our families, our children, everybody has been going through a lot of stress over the past 6 months, in some ways that are visible and some ways maybe not so much. But we are one community, and I just ask that everybody respect everybody else's opinions, whether they want to do school virtually, they think it's working, it's not working, they want to go hybrid, or things that you are counting on if this vote goes through and children return to the buildings that don't work out exactly as you might have imagined they have. Things will happen that don't occur in the way they were envisioned to, and that we can adapt. Our children are watching, and our teachers, our community, when we are not nice to each other, it hurts people sometimes in ways that we're not even aware of. So, I just urge everybody to be patient, and we will get through this. And, I look forward to a very unorthodox, but hopefully ultimately successful, happy, and healthy to the greatest extent possible school year for everybody. So I just really, again, we have a board policy on civility, and I just urge everybody, even if you disagree with different positions that different people have in any manner, shape, or form, our superintendent always says to us, we can disagree without being disagreeable. And I think it's really important, because we're in an educational setting, to set that example for our children, and everybody watches how everybody's treating one another. So with that, I don't know if I'm the last to speak, but I assume that Mrs. Stern is going to call the vote, and I look forward to supporting this motion and see where we go from there.
Is there any other board comment? Lydia, go ahead.
Yeah, I'm going to make this pretty short because a lot's been said, and I think I don't want to rehash the past. I really appreciate the points being made tonight, and I think it's really important to highlight them. And I'm only going to speak for myself. When we voted in July, we really didn't have any guidance. And I think a lot of people were pretty scared because we saw what was happening in other states. But we knew we were 2 months for sure out from the start of school. A lot can happen. So the administration put forth a really good hybrid plan. So for me, I was like, okay, that's what I know now. I'm 2 months away from September. In August, our health department recommended explicitly that private and public schools all start virtually until October 12th. It's really important that sink in, because we were actually trying so hard to get kids into school that I think we were the last district, or one of the last, maybe the same night, one of the last districts in Delaware County to vote that we were going to go virtual. I really wanted kids in school. I wanted kids in school so badly this summer that I would have sacrificed other things that were unpopular, but to try to get kids back in school. So those points are, it's really important to keep that in mind. I'm going to support this proposal. I'm cautiously optimistic. I do think we're being aggressive on our stagger, but I support that. And I think it's really important that we get kids in school. I do want to say one other thing about the concerns around mental health that we hear. And I said this at another meeting, and I think bears worth repeating, because there's lots of people concerned about the mental health challenges that people are facing and that the stress that people are under. But there is a fundamental in mental health that you have to secure physical safety first. And so back in August, when we were told the best thing we could do was secure physical safety, we had to do that. And so I am not in any way minimizing the struggles that people have faced, but with regard to mental health, physical safety has to be secured first before you can address any of the other issues. Now that we feel that we have done that sufficiently, it's time, to move on and address other issues. So I just think those fundamental things, I'm speaking for myself, those are what's guiding me. And if the health department comes back and recommends that we close down again, I will support following that advice, no matter how hard that is for all of us. So I'm going to follow the science. I'm going to follow the numbers as I have all summer. And so I'm really thrilled for students that want to come back. And I think it's also important to remember, I've heard people say, all Radnor parents want kids back. That's not really true. 30% of our parents have elected to keep their kids home virtually. So for the parents that want this, I'm thrilled for you. But for the parents that are cautious or that virtual's working well, I'm happy for them too. So just to put some perspective in things that, we've read or I've heard. And so I will support this.
Okay, Liz, go ahead.
I will support this as well for the reasons that my colleagues have said. But I just want to say about one more comment on the aggressive stagger, or that's what it was called, more aggressive than we originally laid out. I do agree it's a window of opportunity, but I also, yes, I have a vote of confidence in the administration, but I also want to say I have a vote of confidence in the students. We have evidence, we did the voluntary workouts and they rose to the occasion. And, if you did listen to the webinar, anyone who did, Dr. Rubin and Dr. Kaufman, they both said, kids can really, they can do this. They can meet our expectations. So I think as, you know, as parents, we need to set our expectations for our kids, and I think they can deliver. So I'm just doing a vote of confidence, not just in our administration, which I think, you know, you put all the time and the plans into making sure that we can do this safely, but I'm also going to put a vote in confidence for our kids, because I know they want to be back, and or many of them want to be back, and I think we can do this. So Radnor ready.
Got it. Okay, so I have a nursing degree. So all along, I have understood the science of universal precautions. Ken, when you mentioned your dentist, I had the same thought months ago. You know, dentists have already been wearing masks and gloves, and many of them wear eye shields. But they've been doing that for years for all sorts of other communicable diseases. That's how you do it. That's how you prevent spread of a disease. You wash your hands. And we are very fortunate that this is a disease or an illness that relatively simple measures can be done to reduce transmission. Staying 6 feet apart, wearing your mask, washing your hands. These are relatively simple things. And the one thing that I heard Dr. Rubin say, where there comes to be a problem is when people become lax in their social distancing and lax in their mask wearing. And so, Liz, you know, I want to have faith in the kids. I do. And largely I do have faith in the kids, but I also would be remiss to say, if I didn't say, you know, just because we are going to take a vote and it sounds like it's going to pass, you know, we have to keep vigilant or we're going to tank ourselves. And I live in a part of town where I got to tell you, I saw 15 kids Friday night walking down my street. There wasn't
There were more than 15.
Oh, well, yeah,
They were elbow to elbow and playing basketball, no masks.
There wasn't a single mask. And so I really hope that, you know, all the parents in our community who, you know, believe in masking and who believe in social distancing and who really want their kids back in school, I hope you really support your kids and set a great example and really expect it, high expectations of your kids, as Liz mentioned. And I hope those parents who don't believe in it, there are people in our community who just don't believe. Well, I hope you do it also because you want your kids in school. And, you know, don't be the family, don't be the kid that tanks it for other people. You know, that's what we need right now. We need, and I know people are tired. I am tired. Everyone is tired of 6 months of a pandemic. None of us wanted this. None of us asked for this. And, you know, but this is what we've got. This is what we have. And are we going to bring ourselves together and move forward, or tear ourselves apart and tear each other down? And I really hope that we, you know, take a deep breath and take steps forward together, because that is how we will be successful at this. I do believe that the window is here. I strongly believe the window is here. I'm really grateful, Mr. Batchelor and Mr. Bechtold and Mr. Dukevich and your whole administrative team was able to take a look at the data and the circumstances of the last few weeks, and that you were able to bring forth a plan that actually is even more responsive to the needs of our kids and responsive to the data that exists. And, you know, so I am also happily supporting this to get the kids back in, but I am really hopeful our community brings itself together and hunkers down and doubles down on the things that will have this be successful for as long as possible, which is masking and washing your hands and social distancing. All righty, with that, I will call the vote. All those in favor, please say aye and raise your hand. It's a little easier to see. And all those opposed? The motion passes 7-2 with Dr. Babson and Mr. Moore voting nay. All righty, folks. Mr. Batchelor, what do we, let's see, I need to open my screen differently. Do we have any new business tonight? No? Okay. All righty. With that, I'm going to move right into board announcements then. Our next round of business meetings. Oh, we have our regular business meeting next Tuesday, September 29th, 2020 at 7 p.m. That meeting is also scheduled to be virtual. And with that, I will entertain a motion to adjourn.
And just as a reminder for anybody before
Sorry.
we will be discussing sports next week. So I just wanted to, if you didn't watch the beginning of the meeting, that will be on the agenda, and we ask, the community to be patient. I know our student athletes are eager to hear the answer, and we'll be looking at that next Tuesday.
Great. I will entertain a motion to adjourn from Ms. Solomon and a second from Ms. Dunn. All those in favor? Motion passes unanimously. Good night, everyone. Thank you, everyone, for all your good work. Thank you so much.